Is it dangerous to sleep next to a Wi-Fi router? Do we have evidence that it's dangerous? No. Do I recommend it? No. Move it away. Find a different place for it. Don't keep it next to your brain. And also keep your cell phone away from your brain. And keep your cell phone out of arm's reach so you don't reach for it in the middle of the night if you can't sleep, because that's the surefire way to disturb your sleep. What advice do you have for the partners of people who work in medicine? Given the long hours and workload, it can be difficult to stay connected. It's very difficult. Do you know how many relationships end when someone goes to medical school? Tons. But also, do you know how many relationships form? Because you realize that like sometimes attracts like. Humans are magnets. Is it okay to lick a pen? Medically, I wouldn't advise. Is it okay? Ethically, morally, I mean, I think it's fine. Don't lick the part of the pen that releases ink. That's not edible. The way that I think about pens is the same way that I think about our fingers. Our fingers are disgusting. They have a lot of bacteria on them. Like if you touch your phone, you're essentially touching other people's poop. There's poop on everything these days. Keyboards, phones, water bottles, it's all over the place. It's just floating around. And because of that, it's probably on your pen too. And if you're gonna put your pen in your mouth, you're putting poop in your mouth. So is it okay to lick poop? No, then not okay to lick your pen. That's how I'm stating my answer. Is drinking my own blood bad for me? I promise I don't do it on purpose, but it happens a lot. It is a problem. Drinking blood is a GI disturber. Whatever, it's not good for your GI system. In some people, it can cause tremendous constipation because what does blood have in it? Iron. In others, it can cause inflammation and irritation of your GI tract, leading to diarrhea. How do we know this? In those who have frequent nosebleeds and then do this, start swallowing a lot of blood, it can lead to nausea, vomiting, and/or constipation, diarrhea if it stays there long enough. Is it bad to hold and poop? You have an anal sphincter for a reason. It's so that you don't just poop while you're sitting there. If you lose control of your poop, it's called fecal incontinence. And that can happen as a result of all sorts of medical problems. A common one that we talk about or learn about in boards is something called cauda equina syndrome. The lower end of your spinal cord actually starts getting compressed, and it creates such compression that you develop incontinence or decreased sensation in the saddle area of your body. But holding in your poop is a normal thing for a human. So just be reasonable with it. Don't overdo it, because you can actually hold in your poop so long that you start developing nausea and vomiting because you're actually creating a backup in the system. So don't do that. Is it bad to stay up all night several nights a week? It is absolutely bad. In fact, I'm gonna go on record and say the uptick in neurological conditions like Alzheimer's, dementia, etc., I believe is happening due to the fact that we no longer respect sleep. We pride ourselves on sleeping less and working more. We value hustle culture. We stay up late because of social media and anxiety and mental health struggles. And as a result, we're creating brain problems. Why am I able to play any VR game for countless hours without getting sick, but the moment I start driving a car, I get motion sickness? In a VR, people get motion sick because there's a disconnect from what their vision is seeing versus what their semicircular canals in their ears are experiencing. So that sort of disconnect can create nausea in some people that you can get used to. In an automobile, because you're constantly starting and stopping, you're having the opposite disconnect where your semicircular canals are experiencing a lot of activation, a lot of stimulus, but your vision might be looking at a still object. So that's a different disconnect from on opposite ends of the spectrum, and you could have worse motion sickness on one end, but not the other. Every time I wake up much earlier than normal, like to catch a flight, I get really bad indigestion. Is this just coincidence or is something going on? There's something going on. The central nervous system of our bodies works on two different systems. One is the rest, repair, digest nervous system that happens and gets activated when we sleep, when we chill, when we meditate. And then the flight or flight response system, which is like what happens if we see a threat. When we're sleeping, we're in rest digest. If you don't get enough sleep, you don't repair, you don't digest well. So when you wake up early, your body has to go into fight or flight mode. It has to kick in your adrenaline in order to keep you awake and allow you to function normally. And also, many people, to combat waking up early, drink a ton of caffeine, which stimulates acid secretion from your stomach, which can create gastroesophageal reflux, which is like traditional heartburn. What's the difference between an allergy and an intolerance? Such an important question here, because so many people say they're allergic to things when they're really not. And then it creates other problems. So many of my patients say that they have a penicillin allergy when they actually don't. And as a result, they lose a set of antibiotics that are actually quite effective and have a low risk of side effects. An allergy is a histamine-driven response where you actually get itchiness, hives, and you start scratching your skin. There's eosinophils present. You could also have an allergic response to anaphylaxis where your throat starts closing up. You have swelling because histamines start allowing the swelling of tissues by making blood vessels more porous. Then you get cytokines and all these inflammatory cells come, and it becomes a big problem because it closes off your airway. An intolerance is when something just doesn't sit right with you. It causes some other malfunction in your body. For example, if you're lactose intolerant, it's not an allergy because you don't get a rash, you don't get anaphylaxis, but you do have diarrhea. So it's an intolerance, but not an allergy. Why is my pubic hair so curly? Okay, Max, did not expect that one. Pubic hair is a type of hair called terminal hair. It starts as vellus hair on our bodies when we're babies. Vellus hair is the type of peach fuzz hair that we actually still have on our bodies. And in certain areas, due to puberty, we start developing terminal hair. It changes and it becomes deeper, it becomes more coarse, becomes more curly. In fact, pubic hair really doesn't grow longer than like 6 inches because of how often it sheds and breaks down. Also, really interesting about pubic hair, never thought I would say that, but I think the reason that it's curly is because back in the day, cavemen days, cave women days, we had a bush, and that bush helped us have better locking in of our pheromones, that smell. It was actually an aphrodisiac at this time when we all walked around without clothing. It was an advantage for those who had curlier pubes to survive. Also, pubes are great protection from friction. What are smelling salts made of? How do they work? You sniff them and the nasal receptors get so irritated by them, it sends a shock response to your brain and it wakes you up. Is there a way to minimize the appearance of scars? There are things you can do about scars. Mostly, and where I see the best results from, through lasers and through surgical approaches. There's very little thing you can do topically in terms of like putting a cream on it. There are some creams that do some benefit in terms of smoothing the scar, but removing the scar can only really be done surgically or with a laser, which is basically a type of surgery in my opinion. My friend Dr. Bonasali does a great job of this on his Instagram channel. Dark Highness 6666. I'm a woman and I sneeze too loud. It's embarrassing. What can I do to not sneeze so loudly? Sneeze loudly. Just dab when you do it. Don't let anyone judge you. The fact that you're worried about this is worth investigating with your doctor because you should not feel ashamed by carrying out a normal human body act in front of others. Everyone sneezes and it's okay to sneeze. And if you sneeze loudly, who cares? Are there parts of my body I shouldn't shave? That's actually a good question because, you know, we shave our faces. Some people shave their armpits. Benign, but actually can create friction, especially if you do a lot of running. The problem with shaving your pubic, I feel like we're covering a lot of pubic stuff in this video. The problem with shaving your pubic region is there has been some research showing that there are increased STI rates when you do shave because more skin-on-skin contact, so more chance to spread STIs. Also, when you shave, you can create micro tears leading to openings in the skin, which can allow body fluids and blood to get into, thereby creating another infection. Maybe skipping out shaving the pubes is not a bad idea. When you need a knee or hip replacement, how do doctors know the right size? That's a good question for an orthopedic surgeon. I'm pretty sure there's a measurement they do prior to inserting the instrument. Look at the x-ray and they'll get a general sense, but then they probably trial different sizes like in the operating room and they see. Orthopedic surgeons, please chime in. Hey doc, what do surgeons do with tumors once they've been removed? Generally, we send them to pathology for analysis through microscopy to see what kind of tumor they are, how differentiated they are, what cells are present. In some cases, like with skin cancers, we do a cutout and sometimes we look right then and there to make sure that we cut out the entire margin of the tumor to make sure that we didn't leave any cancer cells behind. Why do humans randomly get itchy? I understand why you itch from hairs or bugs being on you, but so often I itch when there's nothing touching me. What gives? Okay, Teresa, this is very important because if you're itchy like that to that degree, perhaps there's a medical condition going on, perhaps allergic, perhaps otherwise, but we would need to investigate that further. There's many reasons why humans get itchy. Itchiness can come from something physically bothering your skin, or a chemical reaction bothering your skin. Both can cause itchiness. And there's also like the nerve thing, like nerves misfire and can make it feel like an itching sensation is present when it's not really there. I'm thinking about becoming a nurse, but I have a serious fear of needles. Do you think it's worth pursuing, or should I look into something else? That is something that you can overcome. There are legitimate medical treatments and therapies targeted at those who have phobias of any kind. Needles are one that you can definitely overcome. So if that's the sole thing that's preventing you from having an amazing long career that is much needed, do not let it stop you from having a very productive, rewarding job. How does the heart keep beating and beating for years and never stop? Don't stop, won't stop, heart beats for life. It just does. You have an SA node, an AV node, the Purkinje fibers. They go throughout your heart and they help your conduction. If the electrical system is there, the musculoskeletal system will listen, as long as everything else is in place. You know, oxygen, electrolytes, all the good stuff. Okay, so pathologists study a tumor once it's removed, but then what? Does it get incinerated, sent to the dump, shot into space? Well, it doesn't get shot into space because that'd be quite expensive. It gets thrown out in the biohazard disposal. What happens with it then? I have no idea. But you've seen those biohazard red bins, that's where the tumor goes. And there's no need to incinerate it. You don't need to burn it. Actually, I guess if there's like infectious things in there, maybe you do need to burn it and it ends up being incinerated. Like, let's Google what happens. What happens to biohazard waste? Oh, 90% of biohazard waste is incinerated. The more you know. An onlooker has the choice to save 5 people being in danger of being hit by a trolley by diverting the trolley to just kill 1 person. We know Dr. Mike would pull that lever because he has no problem murdering someone for charity. #creator clash. What is that? I don't get it. Oh, because I murdered iDubbbz for charity? I didn't murder him. He's doing great. Would you divert the trolley to just kill 1 person? Oh man. There's too many other factors that I don't have the information to. And as a doctor who thrives in the sea of nuance, I refuse to swim in this ocean.
Ooh, good answer. That's professional. Well done.
Is it bad to draw on my hand with a pen? My mom tells me it would give me pen cancer. Never heard of pen cancer. Heard of pen 15 cancer, if you know what I mean. Do nipples grow back? Do they grow back after what? Is my question. If you had a traumatic thing where you lost a nipple, no, just skin would form there. 1, 2, 3, music. If I scratch my mosquito bite, will it get itchier? Absolutely. The reason this happens is because of histamine production. The more you scratch, the more inflammation, the more histamine, the bigger the hive, the more itchy it becomes. And if you cause excoriations, which means openings in the skin, you could actually create an infection on top of it, which is a problem because now you're gonna have to put steroidal cream to decrease the itching and then an antibiotic cream to fight the infection. Is it true that if you chew gum while studying, then chew the same flavor gum while taking the test, you'll recall the information you studied better? It's possible. They say that you should try and replicate your study environment as much as you can during your testing environment. I think that probably goes a step too far. You're probably spending more effort in trying to do this kind of hacking thing than actually the effort that you could be spending on studying. If you love chewing gum and you love the minty flavor, stick with the minty flavor, don't change. And know that if you cram and you stay up all night, it won't enter your long-term memory, the information you studied. Is it weird to go to a doctor for multiple things at the same time? What should I do if I have several things to go over in only a few minutes? Great question. Can we cover multiple issues in one visit? Sometimes yes, sometimes no. If your symptoms are connected and can be pointing to one universal problem that's causing all of these symptoms, if you have diarrhea, are sweating profusely, are having palpitations, perhaps you're having a thyroid issue. And had you only presented one of those concerns to me, I might miss the thyroid issue because I think, oh, diarrhea, maybe just an upset stomach related to something you ate. Why sometimes no? Well, if you come in and you say your foot hurts because you sprained your ankle, but then you also get headaches sometimes, and then you're also due for your pap smear, you could see how we can't get all that done in one visit. But a good doctor will say, what's the most important to you? And what they think the most important is to address in a given moment, meaning what's the most timely. And then we can reschedule you for a follow-up visit. Does it matter when during the day humans get 8 hours of sleep? I have friends who are bartenders at night and then sleep during the day. If you're getting 7 to 9 hours of sleep, that's important. But then consistency is also important. And then also the time of day of sleep is also important. Humans are not nocturnal creatures. So we need to be out in the sun, and that's how our circadian rhythms work. People who work during the night and sleep during the day have more health problems on average, and we don't have the exact reason as to why that happens, but we know that it's definitely present. We actually even have a disorder called shift work disorder from individuals who have that problem. When I have aches and pains, I treat it with a cocktail approach. Some acetaminophen, some ibuprofen, some aspirin, all at once. Should I continue this approach, or is one better than the other? Is one better than the other is actually a question I get a lot from patients. They're like, I have this ache or I have a fever. All three of these medications are pain and fever reducers. There's certain instances where I would recommend one over the other. One is not the best. For example, if you have kidney problems, you may not want to be taking an ibuprofen medication, which gets excreted through the kidneys and can potentially damage the kidneys. If on the other hand, you have really bad liver disease, maybe you want to not be taking acetaminophen because that gets metabolized within your liver. There's different instances where you want to be smart. For example, if you're prone to bleeding and have a bleeding disorder, aspirin can actually inactivate your platelets and cause you to bleed more. I try and minimize the use of these medications because reducing fevers is not always a good thing. A fever is beneficial. It's helping you overcome whatever infection you may have. So unless there's a reason, we shouldn't be lowering a fever in many cases. Has a patient ever come in with a disease or condition you've never heard of before? Absolutely. Remember, I'm a family medicine doctor. Anything can walk through my door at any time, and I have to not only figure that out, but also maybe even learn about that condition right there on the spot. And the more open you can be with the patient about what you know and what you don't know, the better that line of communication is gonna be. Because not everyone can know all the answers right away. Why does taking a long, deep breath help calm you down? Because it actually activates your vagus nerve. That is the primary nerve in your body responsible for parasympathetic tone, meaning your ability to begin rest, repair, and digestion. If you're very riled up, you could have decreased activation of this vagus nerve, and as a result, be very on edge. So when you take that deep breath, it actually helps normalize the parasympathetic tone, helps calm you down, and you chill out. Why do I sometimes like the smell of my own farts? Okay, Chrissy, didn't expect that you'd go there, but there's actually a psychological phenomenon that's occurring here. The longer your body is exposed to a specific stimuli from outside the body. So for example, when you try and go to sleep, white noise works well because your body starts to tune out the white noise because it's the same level of noise. That's why noise that's like quiet and then really loud will wake you up at night because it triggers your brain to react to it. But if you constantly over time smell your farts and smell your own body, you become accustomed to it, so it doesn't trigger that same level of response from your brain. So when others smell other farts, poop, or what have you, it triggers in them that there's a foreign substance, potentially poisonous substance that they should stay away from. But when it's your own, your body is not having that threat because it's been smelling it for so long, you have a decreased stimulus response. When people train to hold more air in the lungs, what exactly is getting stronger? Do the lungs inflate more? Well, yeah, the lungs can inflate more. Hormonally, things change. Cellularly, things change. Like you're able to produce more red blood cells. You have a higher hematocrit. You're able to withstand periods of anaerobic stress for longer periods of time, so you have better lactic acid removal from your body. So it's not just like hold more air in your lungs, it's the processing of being in an anaerobic state that is equally important in this situation. Hey, Dr. Mike, my family tells me that eating too much salt will melt my bones. Is this true? And if so, how much salt is too much? Melt your bones? Melt? I don't know. Is it ideal to eat too much salt? No. There's recommended dietary intake for every age group and it's different. It's also based on health conditions. So I can't give you an exact number, but just don't oversalt your foods. Moderation. Why are some people able to live well into the 90s if they are heavy smokers? Well, this is important, and it kind of brings up the notion of what happens when you have unhealthy habits. Too often I tell patients, hey, you shouldn't smoke, and they say, well, my loved one lived a long life and didn't even have lung cancer. But the important thing to remember is not all smokers end up getting lung cancer. In fact, most smokers don't get lung cancer. A lot of smokers get diseases like COPD, emphysema. These are quality of life reducers and quantity of life reducers. So you may live into your 90s, but you have to live with an oxygen tank and have such bad dyspnea or shortness of breath that you can't walk to the bathroom without feeling a tremendous amount of air hunger. It's not just do you die, it's how well you live and with what conditions you live. How can I prevent my nipples from chafing on my shirt when I run? You know what's funny? I've never in my life had this be a problem. Maybe I'm not running enough, but I feel like with boxing, on a given week, I'm running 20 miles a week. I feel like I should have experienced this. I don't. Maybe I have chafeless nipples. If you are truly having an issue, I've heard Band-Aids do a good trick on this. There's also like some anti-static spray you could put on your body. I've never had a patient with this. I've never had it. It's interesting that so many people do talk about it. Is it bad to wear Converse Chuck Taylors when I do squats at the gym? So many lifters say they're great shoes for lifting, but when they aren't sold in sports shoe stores. Well, correct me if I'm wrong. These shoes were initially a basketball shoe, like back in the day. I do think they're great because they're supportive for lifting and they also have like a very flat sole. I do think there are more sports specific shoes that you can use to lift, but I've worn them before and I've had good success lifting. Is it bad to fall asleep listening to something? Only when it's your significant other. They might get upset. But if you're using like a white noise machine, it's great. What I don't like falling asleep to is music that changes in intensity, and TV shows or movies. Why? Because if your brain is getting a steady stream of information of sound, it's gonna do fine and you'll be able to fall asleep. But if you're starting to get low sound with a big explosion, that's gonna wake you up. Have something that's on faintly in the background as white noise, great. Anything else, not a big fan. My cat refuses to use the litter box. Can you help? You want me to have a one-on-one talk with your kitty? I have no idea. Never had a cat. Don't even know really how you teach a cat to use a litter box. If you wanna let me know in the comments, I'll improve my cat knowledge. Why does skin grow back from a minor cut, but a limb won't grow back if it's cut off? Why do some body parts grow back and some don't? It really depends on the initial type of stem cell in a given area. Bone heals and grows back, skin heals and grows back, nails heal and grow back as long as you're not damaging that base layer there. But full regeneration of most things don't happen. Even for a liver to regenerate part of itself, it needs to be there. Like some of it needs to be there. Yo, doc, I keep seeing these ads for posture correctors on my IG. Do these really work? Should I get one? I need to see the evidence on them in like a rigorous trial to see what it means when they say they work. If that doesn't lead to decreased pain, an improvement in range of motion, then the thing itself fails. Now, for me, I would much rather get you in a place where we strengthen your core muscles, your back muscles, your stabilizers. We get you in a healthy range of motion where you don't need a posture corrector. I think that's one of those gimmicky tools, at least for now, that you probably don't need. Why does it feel better to sleep on the cool side of the pillow? I think this has something to do with your body temperature, your core body temperature dropping when you do go to sleep. Like a lot of those memory foam mattresses tend to gather and store heat, so much so that when you're laying on one side, you just like feel that heat bouncing back at you. That can disrupt your sleep because your body tends to stay cool in the early part of the night. So that's why I think we like the cool side of the pillow. I like it mostly because it's how I grew up. I always hung out with the cool pillows in school. This is one of the hardest questions, but here goes. Which is more important, the heart or the brain? Bro, the heart can't do anything without the brain. You know when they say someone's all heart? I say that's the brain being humble and not taking credit where it's due. Is it okay to never wear underwear? I would recommend it just cause like bodies have all sorts of discharges and stuff and it's gonna get on your clothes. Like you don't wanna lift up your leg and like flash everybody. Genitals might be more sensitive to the chafing of like jeans and certain pants. Protect your junk. That's what I say. Could you do a video about if essential oils can actually help you? That would be a very short video because it would just be like this. Essential oils sometimes smell good. Check out this video. Why do we feel the need to stretch when we wake up in the morning? Well, Lynn, because you've been immobile for a while, and a lot of times you've had pressure on certain parts of your body for extended period of time. So naturally it feels good to stretch and get that blood going, get those muscles warmed up in order to face the day. And that's recommended. Do you have any favorite Russian food you remember from growing up? Pelmeni, my favorite food as a kid. Borscht, close second favorite. And pelmeni are essentially like Russian raviolis, but so good. Doc, settle this once and for all. Is chess a sport? It's competitive. It burns a lot of calories. Yeah, I think it's a sport. If we're gonna call esports a sport, chess is a sport, god dang it. Ooh, I don't know why I got my inner football coach out of me on that one. Hey, Dr. Mike, is it true that wearing the wrong shoes or clothes can actually hurt your body? Are there other things I should avoid wearing if I'm actually trying to stay healthy? Yo, this is such a good question. I've actually made videos about this topic in the past. Clothes do impact your health. For example, women that wear high heels for way too long periods of time for many years can actually develop some deformities in their feet. A bony deformity on the back of their heel called a Haglund's deformity, also known as a pump bump, where it can actually lead to Achilles tendonitis or other types of bursitis. You can develop bunions, a neuroma inside your foot, and all these are painful conditions that usually, if you continue wearing heels, will need surgery. And know that heels don't just impact your feet, they impact everything above as well, because it changes your gait, it changes your balance, your stride, so you get knee pain, hip pain, low back pain, etc. But it's not limited to just heels. It's stuff that you wear on your body too. Like, we athletes love compression gear. And yes, when you get all sweaty, it doesn't matter if you're wearing cotton or a polyester compression gear. If you don't get out of it, it's gonna be a problem for your skin. But compression gear presents a very unique problem in that compression gear tends to pull the oils from your skin into it. So it kind of over time prevents your skin from being able to breathe with all that compression. And as a result, you can form acne on your skin, folliculitis, even intertrigo into the crevices within your body. I recommend getting out of those clothes as quickly as possible and washing them very thoroughly. Because if you ever had a gym bag with some of that polyester gear in, it stinks because the type of bacteria that eat the oils from your skin that's trapped inside that gear release a really foul smell. And it's different than cotton because cotton doesn't absorb the oil, it absorbs the water. So if you leave cotton on for too long, there's like a chance of fungal infections, mildew if you don't let it dry, but it's just water, so it doesn't smell as bad. It has a slightly different odor to it. That being said, for women who also wear shapewear, that can also be problematic. If you're putting a lot of pressure on your abdomen, you could actually worsen symptoms of acid reflux because you're putting pressure on the abdomen. It can cause that acid to come back into the esophagus. Big problem. For guys who love wearing neckties, I'm a tie guy. I love wearing ties. But if you wear the tie too tight, there's actually research that's been done that shows wearing a tight tie will decrease the amount of brain blood flow. Think about that. If you're going to a meeting and you want to be sharp, you need maximal blood flow. So loosen up those ties, maybe ease up on that shapewear because it can present a true problem. Oh, one that, this is about to become a whole video on clothes, but if you wear very tight compression like shorts or shapewear on the bottom of your body, you can develop a condition called neuralgia paresthetica. You could put so much pressure on the nerve that gives sensation to your anterior thighs where you feel like numbness and tingling and burning in the thighs just from wearing that compression and putting pressure on that nerve. God, clothes, health, so interrelated. Who knew? Maybe I'll do a whole video on that. Mental and physical effects of your clothes. Can you explain what causes kidney stones? I've passed over 50 in a year. And because of the pandemic, my hospital won't see me, so I'm left to just take pain relief and move on. 50 kidney stones in 1 year is telling me that something is going on in your body that is outside of your control that needs urgently to be addressed. And you need to address it with a urologist to find out what condition you have that's predisposing you to so many stones being formed. Because my suspicion is if you were simply an individual who ate a specific diet and was dehydrated very often, you would not form that many stones. So to me, it tells me that there might be a metabolic condition, kidney condition, even an anatomical condition where urine flow is not passing in the way that it's normally supposed to occur throughout your urinary system, and as a result, that's causing stones to form. Is it safe to go in a hot tub every day? I mean, like, I don't see the harm in it as long as that hot tub is maintained and you don't have like a rash or any other illness. Just dry off after and don't stay for too long and don't overheat. Hot tubs can be problematic if you have like a heart condition because they get you warmed up, and when you get warmed up, your body has to kick your heart into higher gear to beat faster to cool off. Also, there is something known as hot tub folliculitis, where you can get an infection of your hair follicle from a bacteria known as Pseudomonas. Looks painful, feels painful sometimes. Have you ever been told off by a nurse for doing something dumb? Absolutely. Maybe not so much recently, but definitely in my training days, I made mistakes all the time. In New York City, when I was working at a level 1 trauma center, if you mess up, they'll shove you out of the way and start doing it themselves. Like when I was first learning how to do blood draws, I wasn't that great at them, and I had to learn from people who were better. Most of the time, they were nurses. Why does swaying a baby put it to sleep? It probably has something to do with the movements that it's experienced when the mom was moving around and it was in utero. When you have swaying, you also have a constant signal to the brain. And when you have a constant signal to the brain, whether it's audio, movement, that is relaxing to us. Whether we're talking about white noise or we're talking about swaying a baby, I think all of that is pacifying just from different variables. Like one is from audio, one is from movement, etc. Yao Ming 2.0, Dr. Mike, why do some people have a dark neck and how do you get rid of it? What you might be asking about is a condition called acanthosis nigricans, which is a darkening of your skin that can happen with certain medical conditions, most notably diabetes mellitus, where you have poor control of your blood sugar because of a malfunction related to insulin. That being said, it could be something as simple as you don't wear sunblock and you're exposed to sunlight on the back of your neck and not the front. So like it really is important that you do a thorough history and physical before you just go start ordering tests. What are your thoughts on medical professionals using their place of work to make a social media content? Would you as a patient feel comfortable visiting a doctor who was on social media and used the practice you were visiting as their studio, so to speak? Well, it depends on how they're using it. Are they using it respectfully to educate without making anyone feel uncomfortable and still respecting everyone's privacy? If so, why not? I would be excited to go there because I know what that doctor or that practice stands for. I actually get kind of an inside look on how they work, and it gives me insight into their relationships. And if I know that they're all close with the staff, that kind of makes me feel at ease. What are some alternatives to therapy? It's not for everyone. There has to be other options, right? Well, first of all, there are different types of therapy. Family therapy, DBT, CBT, but really the ultimate thing that decides success in therapy is your connection to your therapist. There's all types of other therapies, equine therapy, animal therapy, music therapy, that can be used in specific situations, but it's always important to make that decision with the help of a mental health professional or a medical doctor. Should I wear gloves when I lift weights? You can go in many directions here, Bailey. Some people, for aesthetic reasons, will choose to wear gloves. They want to prevent calluses from forming. I think the callus is beneficial as long as it's a healthy callus, meaning that it's not too big, it's not overly dry. Because what happens is if it gets really big and overly dry, it can totally rip off and then you have no padding at all for the weight. So you need to be smart and in some instances maybe wear gloves, or even they have some of these grips where you can just like put on a grip and you don't have a full glove, therefore you're not like retaining all that moisture on your whole hand, but only on the palmar surface. What's a nice gift to give a doctor or nurses or other hospital staff after an extended stay? I think the rule is medically, ethically speaking, it has to be under $30 or something. That's the guideline set by professional organizations. Making a nice meal for them, some cookies or an inexpensive bottle of wine if you know they like wine. If you're my patient, don't give me anything. Just stay happy and healthy and keep working on yourself. What's a subject you wish your professors had spent more time focusing on when they were teaching you in med school? Okay. Hotly contested subject. The one thing I would add, a monthly improv class where you have to live in the moment without preparation, just be there, be a person, speak your feelings. Just yell at each other. Does drinking the recommended amount of water per day throughout the day have the same impact on your body as if you just chugged it all in 1 or 2 sittings? It's not the same. Your body can only absorb so much water, and if it doesn't absorb it, it then goes to waste and you create urine. Which is more important, inhaling or exhaling? Okay, this is important. Inhaling or exhaling? Honestly, as important it is to inhale, I think the exhale is the underrated because you can really get a lot from an exhale. I don't want to go too spiritual with it, but it cleanses the soul. And essentially when you're inhaling, you're getting oxygen. Yeah, okay, good stuff. But when you're exhaling, carbon dioxide, CO2, COOL, cool. Wait, does Dr. Mike have a Discord? There are Discord icons on some of these questions. Yeah, I have a Discord, baby. Join the Patreon. You get automatic invite to the Discord. And the Patreon is $10 a month. I keep none of the money. Each month, You vote where that money goes to the charity of your choice. We have a monthly live stream. We always have fun. You get early access to tickets, to merch. By the way, merch down below. Have you kept up your diet after your last boxing match? Furthest from it. In fact, someone from the Discord sent me a chocolate bar. I ate the whole chocolate bar just now. I'm not proud of it, but I'm human and I make mistakes. And this was today's mistake. Why does cutting my hand with scissors hurt less than a paper cut? Oh, that's such a good question. First of all, I don't think that's true. Just saying as a doctor. I think just the paper cut is less expected. Like if scissors are cutting you, you expect large amounts of pain, so you kind of prepare for it. But just like getting a hit unexpectedly, like getting sucker punch or something hurts much worse. A paper cut, you're like, oh, this is a paper, no big deal. Oh, it cut me. That oh, it cut me moment could be an issue. Our pain perception is not solely decided by the injury, but also our perception of the injury. We basically have like a volume remote of our pain signals. But if we can learn to dial down the volume on the pain, we can get a better control of it without taking medications. I love the smell of scented candles. Please tell me, is there any health benefit to them or do they just smell good? Well, they just smell good, but when you look good and you smell good, you might feel good. And there's health benefits to feeling good. I don't know why I just went Matthew McConaughey on that. What would happen if you got dust in your bloodstream? It should be dusty. I don't know, your macrophages would probably eat it. I don't know, you ask a pathology channel. Is seltzer water unhealthier than flat water? Oh man, the reality about sparkling water is the only population of people that I say should be careful with sparkling water are people who have acid reflux. Because if you already have some acid leaking outside the gut into the esophagus, having bubbles in there, you could actually expand the stomach more and cause more of that leaky gut, especially with burping and stuff. Then everything else, it's kind of not so bad. It might be slightly more acidic than tap water, especially if it has some like flavorings in it. But dentists say like if you drink it with a meal or if you drink some water right after it, like plain water, you're fine. If you're replacing soda, like sugary soda with seltzer, dang right, it's good for you. Is Dr. Mike expecting a child because these dad jokes are getting out of hand? I'm having a baby. I don't have a good dad joke for that. But I am expecting you to laugh at these dad jokes. I saved that one. Are there any benefits to having one blood type over another outside of the ability to donate? We have seen some patterns about certain illnesses happening less and more often in certain blood types, but nothing that we found that we can really act upon. First of all, what useful information is that for you? You're not gonna change your blood type. Maybe you can change your certain activities around certain things because you know you're more susceptible, but are you? You know being on your phone isn't that healthy. I see you doing a little risk reduction though, watching a doctor and stuff answer medical questions so you're growing up here, but I see you. How many times a year do you encounter a live animal in the hospital? You mean like besides the supporting paws program with like dogs? I mean like flies. Are they animals? Is a fly an animal? Sam.
Fly would be an insect.
But is that an animal?
And I believe insects are animals.
Are they?
Let's see. Insects are the most diverse group of animals.
Uh-huh. We caught you, insects.
Is every insect an animal? Despite their age?
How do you clean Bear's ears? I actually have a full grooming video where I groom Bear for like 5 hours. I use like these ear wipes, these medicated ear wipes. I think it does a great job. There's also things that you could put in the ear, kind of squish the ear around, and then let Bear shake his ear out to get the liquid out. Oh wow, you pronounced pilmeni correctly. You really are Russian. Yeah, I love pilmeni is my favorite food. Suksusum? Ooh, pilmeni is suksusum. Ooh, ooh. My mother told me to never stretch in the morning or I will stunt my growth. Is she telling the truth? Say what? Good. I'm not a huge fan of stretching cold. I like stretching after a little bit of a dynamic warm-up. See, you might have a medical condition, then your mom begs you, this doctor doesn't know what he's talking about because you have this medical condition. Say what? For the general person, you stretch in the morning, props. What kind of music does Dr. Mike listen to? What did your Spotify rap say? I will give you 3 of my songs on my Spotify Wrapped 2022. Song number 1, Mount Everest, which was my walkout song to my boxing journey with iDubbbz. Number 2, City of Gods, mostly because of Alicia Keys singing Up New York. And then last but not least, a little Sticky with Drake. If you know, you know. Is it unhealthy for me to never take my bra off? I wear it 24/7 because I'm uncomfortable when I have it on. 24/7, I would say is probably unnecessary. If something's bothering you, pain-wise, definitely a reason to see your doctor, even if you're younger, because it's easy enough to get an ultrasound and make sure that it's nothing serious. Remember, I would much rather you come in with a concern. We not only rule it out anything dangerous, therefore we give you some reassurance, but then we also can make sure that we have a good line of communication. We can give you some risks, things that you're doing that may be unhealthy, that could cause problems down the line, and act early. There's very few things we can act early upon, but if we use the tools that we have, we can really extend not only the length of our lives, but the quality of our lives. Why aren't over-the-counter medication dosages based on weight? They're only based on whether you're a kid or an adult. Well, it matters more when you're a kid, weight-based dosages. As an adult, you have a healthy liver and kidney so that like you have normal functioning organs. There's also a really important takeaway. Plan B, a medication that you use as emergency contraception may not work as well in those who are over a certain number of pounds. So please be aware of that and speak to your doctor about that situation. I've seen people not know that and then make some bad decisions, or at least incorrect decisions about their health. I know undersleeping is bad for my health, but what about oversleeping? If I sleep too much, can it be harmful? Sometimes I sleep in late and somehow feel more tired. That's actually a classic thing, and I talked about it with Matthew Walker on my podcast, where if you're making up sleep debt, where you haven't slept for a certain number of nights in a row, the adequate numbers of sleep, and then you finally get a good night's sleep, that initial few minutes of waking up, you're gonna feel terrible because of sleep inertia, where you haven't yet kind of cleared that sleep debt, and you probably need to sleep a few more nights in order to start feeling better. I heard if you're having breakouts on your forehead, it's because of bad gut health. Is this true, and how can I improve my gut health? Okay, I'm gonna take the second part of the question first. You can improve your gut health by focusing on the things we talk about quite often in this channel. Eating fibrous foods, those are basically prebiotics. Eating a wide variety of plants, aka fruits and vegetables. Limiting the amount of simple sugars you consume, because those things can actually worsen gut health. Now, let's talk about acne on the forehead. Maybe if you're eating a really unhealthy diet, also having a really unhealthy lifestyle and not sleeping and all these things, yeah, you might get a breakout because of a hormonal issue, but changing just one little aspect is not gonna have a drastic outcome on your skin. You need to think about all the variables in your life and try and improve your lifestyle as opposed to finding a hack here. That's not the secret. What's the difference between a first, second, and third degree burn? Depth. First degree burns only affect the outer layer of the skin. Second degree burns affect outer and underlying layer of skin. And third degree burns affect the deep layers of the skin. See, I even had to look that up, even though the answer was outer and inner, or deep. But see, this is stuff in med school that you shouldn't spend hours memorizing, because what ends up happening is you learn a lot of useless information that you could look up real quick. And that's what the new generation of medical student and doctor should be. Someone that knows a lot, but knows things that they can forget, that they can look up real quick, because the ease of information is right there at our fingertips. Are bones wet or dry? They have blood vessels inside them. They're blood. There's blood, so they're wet. Actually, they're spongy. And if something's spongy, it's more likely to be wet than not. Does being slapped actually wake you up, or is that a cartoon thing? It absolutely does wake you up. You know what wakes you up more than a slap? A sternal rub. We actually do that in the hospital to our patients. The sternum is a bone. If you rub it very aggressively like that, it'll wake a patient up. That's how we check if they're actually unconscious or awake or just asleep. What is the leg version of your armpit called? It has a name. Palpatile area. See, sometimes even doctors forget terms. It's the palpatile area. Palpatile fossa. Is it dangerous to eat apple stems? My friend eats the entire apple and I'm afraid she's gonna hurt herself. I've never heard of apple stems being dangerous to eat. I know ideally you don't wanna eat the seeds.
What's wrong with the seeds?
I'm pretty sure they contain some kind of anti-phytonutrient or something. Let's see. Apple seeds can be indeed poisonous from Britannica.com, but it takes quite a few of them to kill you and they have to be crushed, blah, blah, blah. The adult would need to eat 150 to several thousand to be at the risk of cyanide poisoning.
Wow, interesting.
The more you know. Is it true that if you step on crack, you break your mama's back, or if you step on a line break, your daddy's spine? I don't know what kind of bondage question this is, but no. I don't know why there's drugs mentioned in this. You shouldn't be stepping on crack because it's illegal. You shouldn't be stepping on a line break. I don't know what that means.
Do you know what this is from?
No.
Oh, how funny.
It's when you walk on the sidewalk. It's a game kids play. Step on a crack, you break your mother's back.
Whoa, this is some American stuff.
This must be. Yeah, I grew up here.
You see, while these guys were playing that game, I was learning arithmetic. See, my daddy was breaking my spine if I didn't get the arithmetic right. barely alive. Hey, Dr. Mike, what do you think about developing birth control for men? Absolutely necessary. There are already some options out there, so we need to do more of that. Do you ever use your medical training on non-humans like Bear? Absolutely, Joshua. Whenever Bear is sick, I'm trying to figure out what's wrong with him in the same way that I do with the human. Even when I go to the vet, I ask very pointed questions, and they're like, are you in healthcare? I'm like, I'm a family doctor, and Bear's family, so you better take care of him like family. You get me? April, should I put on sunscreen before or after I apply my makeup? That's a really good question. Well, if we take this logically, you want to apply the sunscreen directly to your skin so that it gets absorbed and does its job protecting your body from UV rays. Then you could put the makeup on top of the sunscreen, but the sunscreen has to come on first. Also remember, you have to reapply quite often, especially if you're swimming and or toweling. I love that word, toweling. Say it with me, toweling. If your eye muscles are active all day and during your REM cycle, when do they rest? It's a cycle, so they're not constantly going throughout the night. There are periods where there's non-REM sleep and your eye muscles are relaxed. Also, it's important to note that different muscles have different utilities and some need more rest than others. Your cardiac muscle almost never gets a break during the short time that it relaxes, but your heart beats maybe 100,000 times a day on average. It's a lot of work, and it doesn't stop when you sleep or when you sneeze. Myth busted. Hey doc, are you considering getting another tattoo? Me, I am. I think I have what I want, but I don't know where I want it. So I'm open to suggestions. It is text. So feel free to text on my body right now and send me a tweet of what you've texted on me. Can I use chopsticks? Absolutely. I'm a chopstick rock star. I can all day. I can eat soup with chopsticks. Are you on that level? Why does your funny bone tingle when you touch it or whatever? Well, if yours tingles just when you touch it, there's a problem. There's some inflammation in your cubital fossa, in your cubital tunnel. I'm fossa everywhere today. In your cubital tunnel here. When you hit your funny bone, here's what's actually happening, and I'm gonna blow your mind right now, because the funny bone ain't even a bone. It's actually the ulnar nerve that runs in the cubital tunnel here that leaves your spine, comes down your arm, and comes and gives sensation and motor control to your hand. And unlike regular pain, which is like achy, throbby, sharp, nerve pain, like if you damage the nerve directly, what you're getting is electrical, shooting, awkward pain, tingly, that feels weird. Are there certain foods or drinks that can induce dreams while you sleep? I'm gonna take this question a little differently. Medications can definitely change the types of dreams that you have. I'll give you a personal example. If I was to take Benadryl before going to sleep, I have the craziest, deepest dreams. Like, I will go into a murder mystery with Bear as my psychic, and him and I talk and we solve the mystery together. It happened. Victoria B, do lemons make you lose weight? Are you asking that facetiously? If you put 2 lemons in your pocket, do you lose weight? If you put 2 lemons in your stomach, do you lose weight? No, lemons have nothing to do with weight loss. In fact, lemons, if you eat them, have calories in them. So if you eat enough of them, you can gain weight with lemons. Why is it when you smell something really bad, it makes you want to throw up? That's probably an evolutionary thing that you've developed to make you stay away from that object, because nausea is a very powerful deterrent. If it's already in your mouth, why you throw up is because your body probably senses something is amok there and shouldn't be entering your body and actually encourages you to get rid of it. Can a person with epilepsy still work in a hospital? Absolutely. It obviously depends on whether or not their epilepsy is controlled, because you can't be working with tools if your epilepsy is uncontrolled. So if you're taking the medications and you have a documented history of having it controlled, you can have many jobs. Mike, you've only broken 1 bone. Why are you playing it so safe? You're right, Neil. Let me go break some shit. Is there a difference between CPR and chest compressions? CPR just means cardiopulmonary resuscitation. Chest compressions are part of that. We used to give rescue breaths, but we realized that there wasn't enough benefit to doing so. It actually stopped people from performing the chest compressions, which are actually the most important thing to increase someone's survivability until help arrives. Bronwyn S, is it safer to wear over-ear or in-ear headphones? Oh, I'm very passionate about this. First of all, if you are cycling or running outside and there are motor vehicles around, make sure you do not use noise-canceling headphones. It will save your life. Second, if you use in-ear headphones and you have earwax, the earwax gets pushed further and further back, and then it starts clogging your ears, which can lead to you developing an infection. When you're listening with your headphones, whether they're on ear or in ear or over the ear headphones, make sure that you're listening to less than 60% volume, because you will damage your hearing over time if you continue listening above 60%. Dr. Mike, can you recommend a great source of protein? I'm trying to bodybuild. Zaid, it depends. I'm a big fan of getting your protein naturally from foods, ideally healthy foods, beans, nuts, white meat, chicken, soy. Whey protein could be an option for some, although it doesn't vibe with everyone's guts. Some people do have upset stomach with it. Does cold weather actually give people colds? Nope. False misinformation, but it does increase the susceptibility of colds because if you are very cold and aren't dressed right, that can hurt your immune system. Also, in the wintertime, the air is more dry, therefore drying out your mucous membranes. And the fun part that I like to talk about most is germ hang time. When the air is dry, you sneeze into the air, the germs hang around a lot longer. Austin Graham, hey Dr. Mike, why is eating salt so bad? I hear about people having to reduce their sodium intake. It's not inherently bad. We need to stop villainizing nutrients because it creates so many other problems. Here's the best nutrients and here are the worst nutrients. It doesn't exist. It depends on who you are and what problems you have. If you have congestive heart failure and you already have high blood pressure, yeah, you should monitor your salt intake because that could be a problem. But in general, be reasonable, listen to the guidance that your doctor has given you as an individual, as opposed to reading nonsense articles online that usually doesn't apply to you. Why is it when you get up too fast, you get lightheaded? All right, fun question about orthostatic hypotension. Your body has a blood pressure that it needs to maintain in order to keep blood going from the lower part of your body against gravity and feeding your brain, right? Because your brain's at the top, gravity's pulling your blood down. When you stand up, you suddenly need to raise your blood pressure very quickly in order to make sure that the blood keeps reaching the brain. So what your body has to do is it has to sense that change of pressure really quickly and adjust by squeezing the arteries in your legs in order to shoot that blood back up into your brain. Now, if you're a little bit older, if you're a little dehydrated, you can't maintain a good enough blood pressure, or you can't adjust your blood pressure as quickly, you will feel a little lightheaded when you get up, and that's why you should get up slowly, and you should always have support and make sure you don't fall. How do you know if you have high blood pressure? Please answer, please answer, please. I can tell you have high blood pressure from reading your question here in all caps. You measure your blood pressure using a sphygmomanometer.
Is that how you say it? I thought it was sphygmomanometer.
What? Such an important point. One elevated blood pressure measurement does not equal the diagnosis of hypertension or high blood pressure. That is simply an elevated blood pressure reading without the diagnosis of hypertension, because it takes multiple. Lil Davey, Dr. Mike, I have to meet you. When can we make this happen? Come on tour. Details down below. Seriously, tickets are selling out fast, and if you want to meet, you gotta get a ticket. I see those jaw trainer things on TikTok, do they actually work? Bro, Cristiano Ronaldo got paid mad money to do that ad, and you shouldn't really be using these things because the masseter muscles are really strong. But the reality is if you overdo it, you can create problems in the TMJ area that literally cause you to have a pain in the head. Not a pain in the butt, but a pain in the head. And then at night, if you overtrain these muscles, you can start doing teeth clenching and teeth grinding, wearing down your molars. You do not want these problems, trust me on this. I've seen patients who suffer with it. It's a big problem. Corgi Land, Reddit, if I sweat a lot, do I pee less? Yes, your urine becomes more concentrated because you have less fluid to eliminate. So that's why when you sweat, you should always be drinking more water to make up for the losses that occur when you sweat. Also, remember, when you have a fever, you also lose fluids more rapidly, and as a result, you should be drinking more fluids. What would happen if all your bones suddenly teleported out of you? You become a bag. You just be a bag. And the handle would be like your mouth. Because teeth are not bones, so you could still grab by the teeth, and the teeth are like the handle. Clearly, I've watched one too many horror movies. Is it possible to get food PTSD? I had to take a cinnamon apple flavored medicine for a flu 2 months ago. I don't know what medicine that is, and I'm pretty sure it didn't do anything. Sorry to say, a lot of over-the-counter medications are unnecessary for flu, and it made me throw up. Clearly it didn't do well for you either. Ever since, if I smell or see something cinnamon flavored, I feel nauseous for the rest of the day. I wouldn't necessarily call this PTSD, medically speaking, but colloquially speaking, meaning just like in average words, I understand what you mean by PTSD because it's an experience that is bringing back a memory, but it's really more of your olfactory region of your brain being very intimately tied to the memory portion of your brain. And as a result, that nasal smell that you experience transmits to the memory, makes you remember how you feel. Is it unhealthy to eat your boogers or does it help boost your immunity? I would say it is unnecessary. And I would say it's unhealthy because odds are if you're eating your boogers, you're probably doing it with dirty fingers and your digits are potentially the dirtiest, highest bacteria count portion of your body. So don't eat your boogers. Is it possible I just became lactose intolerant later in life? I was drinking a frappe and then I had intense abdominal pain and an urge to use the bathroom, and it's happened every time I drink milk since. This has never happened before. Not unusual to develop or lose allergies and intolerances throughout your life. Sometimes they can even be temporary due to some sort of illness, sometimes viral related. Don't know if that's exactly what's happening to you, but definitely worthwhile to talk to a doctor about it. I really want to start exercising more, but I find going to the gym or running so boring. Is there a more fun exercise you'd recommend? Yes. First of all, try all those exercises that you found boring with a friend. That goes a long way. Try taking a boxing class where they teach you techniques and you're punching the bag and you're learning how to move around with the bag. Try rock climbing, try bouldering, try stepping outside of your comfort zone and taking a dance class. Any type of movement that makes your heart rate go up is considered exercise. So have fun with it. Andrea from YouTube, I'm on a long wait list to be seen by a new therapist. Is there any self-help things I can do in the meantime? Okay, journaling, very beneficial. 3 good things at night, very beneficial. Like literally writing 3 good things for a period of 2 weeks can help reshape your mind into how you're thinking about your anxieties and the good things that happen that we oftentimes overlook as a survival mechanism that our brain does. But the best thing to do is something that I recommend to all patients called bibliotherapy. Read a book called Feeling Good or Feeling Great by Dr. David Burns and do some of the exercises in those books. I think it's a great way to start. If obviously it ever becomes the symptoms become so severe that you feel like you're losing control, that's a 911 call. But otherwise, I think bibliotherapy for mild symptoms is a great place to start. Gavin H from YouTube, if I drink a glass of water, how long will it take until I pee it out? What about food? If I eat a big meal, how long does it take to come out? Does any of it come out in different times? There's a lot of variability here because if you consume water and you are already well hydrated, so it's like excess water, it'll come out faster. If you consume water and then a caffeine-based substance like tea or coffee that acts as a diuretic, it will also come out faster. Food, so many variabilities. Is there fiber in the food? How much did you eat beforehand? At what time of the day did you eat? How healthy is your digestive system? For example, my patients that have diabetes can develop something known as diabetes-related gastroparesis. The natural waves called peristalsis that keep the food moving in your gut actually get sort of thrown out of whack. And as a result, therefore, food doesn't move as well throughout your gut. So you feel bloated, you develop nausea, vomiting. So as you can see, Gavin, a lot of variability here, so I don't want to give you a surefire answer. Chassis Red, YouTube. My mom always told me the best way to get rid of hiccups is for someone to scare you. She's right. I actually don't think that's a good way. And remember, there's actually 2 nerves involved when it comes to hiccups, because that's happening as a result of a diaphragmatic spasm. The diaphragm is that giant muscle that sits below the lungs that pulls the lungs down to breathe and then pushes up and relaxes and then helps the lungs exhale. So in this scenario, you have the vagus nerve interacting with the phrenic nerve, creating this diaphragmatic spasm. And what I found to work best for me and so many of my patients is a little spoon of granulated sugar. There's also some really good evidence-based methods for breathing into a paper bag to increase carbon dioxide levels, or like taking a breath in, holding, taking another quick deep breath in without exhaling, and then another time, one more time. There's actually a prescription medicine called Thorazine that you can use to control hiccups when they're gone on for days on days on days, and you can't control them with the natural methods that we just discussed. But we really reserve those for complex cases. And they do happen with certain chemotherapy agents and surgical situations that I've seen in my patients in the past. Is a stinky belly button a healthy belly button? I'm gonna go ahead and venture to say, with the exception of your excrement, AKA vomit, poop, nothing should really smell bad on your body. Your nose is acting as a chemical receptor to tell you that there's something off. So for example, if your belly button starts creating a foul smell, odds are there's some kind of bacteria and or fungus having a little nightclub party in there with DJ. What's the thing you pull out of your belly button called?
Lint?
DJ Lint spinning.
Lint biscuit?
Lint biscuit. Cloud enthusiast, Reddit. Okay, but like, how do doctors learn CPR? Do you have to go to a normal CPR class like normal people? Is there just one day in med school where they teach you? Is there a whole semester long course called CPR 101? That would be epic. I would go to a chest compressions year-long course. You do something called BLS, and while pretty much anyone can go to this as long as you sign up, most medical schools have a day where all the students are scheduled to go through this. And then usually what we also do as physicians is called ACLS training, which is the next step after BLS, because that's basic life support. What to do if the heart full on stops and you need to intervene, you need to give medications. If the heart is being so fast or so slow, how to intervene, things to check. This is my BLS provider card here that you get when you complete the course. My ACLS provider card. Look at that, American Heart Association. Did you see my kiosk? If you haven't, check it out. If someone goes through a horrible accident and loses a limb, will that limb go stiff from rigor mortis, or does that only happen to the whole body? Oh, that's a good question. I have no idea. I have not experienced enough traumas in my medical education to know if that's true. Mosh Pit YouTube, why don't we ever sneeze while we're asleep? Why does it only happen when we're awake? It probably can happen to some who are in light sleep, but in deep sleep, these types of reflexes are probably suspended. And I still think like if there's enough stimulation of the airway, you probably could sneeze out of a sleep, but you're awake at that point, so you're not asleep. Tricky questions, like what came first, the chicken or the egg? The sneeze or the sleep? Hey, Dr. Mike, do I need to eat the actual fruits and vegetables, or can I just take the vitamins that have the same ingredients? That way I don't have to waste calories on the veggies. No, eat the veggies. What vitamin supplements are the things that we've so far learned that is the healthy part of fruits and vegetables. It doesn't mean that's the only part. There's so many other things within fruits and vegetables like phytonutrients that we don't fully yet understand or have fully yet explored. And also there's other benefits to eating fruits and vegetables outside of the mineral and vitamin content like fiber, which supplements don't contain. I've had a hernia, so I've assumed for a number of years it only hurts when I press on it. Is there any reason I should go to the doctor to treat this, or can I just go on not doing anything about it for another decade? I'm gonna talk about an inguinal hernia now, because there are other types of hernias and they all carry different risks. But if we're talking about an abdominal hernia or abdominal wall hernia, what ends up happening is you create a risk for something known as bowel incarceration. Your intestines, AKA your gut, actually can poke through this hole because a hernia is an opening in the abdominal wall. And if you have an opening and a piece of the intestine sticks out of that wall, and then it starts getting choked out because of its positioning. When I say choked out, it means the pressure around it due to inflammation or its position starts increasing so much pressure that it cuts off circulation and starts strangulating that bowel. That's a surgical emergency because that bowel is literally dying and needs to be rescued. So the reason why we proactively operate on hernias is to decrease the likelihood of that happening. And what's interesting about hernias is that the larger the hole, meaning the bigger the hernia, the less likelihood that an incarceration or strangulation of the bowel would actually happen. So it's the smaller ones that don't look as bad that actually tend to be more problematic. When I've got a cold and I'm blowing my nose a lot, my snot changes color. Sometimes it's clear, sometimes it's yellow. What's the difference? It's about the cells that are present inside your snot. A lot of people make the assumption that if their snot is a certain color, they know whether or not it's a bacterial or viral infection. That's not always true because, for example, many people say if your snot is green, that means you have a bacterial infection. That is true in some cases, but at the same time, sometimes your snot can start being clear and then towards the end of your viral illness, change color to something that's yellow or green and still be viral and not be bacterial. So I don't use that as the sole judge of what's going on. It needs to be thought about in a whole spectrum of whether you're having bacterial-like symptoms, like fever, sinus tenderness, and then the color of the snot can be one of those variables, but I wouldn't use it as the sole discriminatory point for making a diagnosis. Why does Vicks VapoRub make, I love that you said VapoRub.
VapoRub? I only got a B in geography. VapoRub? So my girlfriend just dumped me. VapoRub.
By the way, the podcast with Stephen He is a banger, and if you haven't signed up and subscribed to the Checkup podcast, you're missing out. Check it out because everyone's loving it. Why does Vicks VapoRub make my cough go away faster than cough medicine? What is that stuff? I'm pretty sure Vicks Vapor Rub is just menthol. Menthol is interesting because what it can do is create a cooling sensation, which feels good. Maybe create some opening and dilation of the airway on a superficial level. But in reality, cough medicine doesn't really work. I really don't use cough medicine in the huge majority of my patients unless I'm treating the source of the cough, like acid reflux, postnasal drip, asthma, where I can give them an inhaler to bronchodilate the spasm away. I like using a steam inhaler for when I have a cough. It really feels like it opens things up. Why is it so much harder to fall asleep as an adult than it is a kid? We have a higher sleep need as children, meaning we sleep for longer hours. And as we get older, the need for deep sleep decreases. The amount of sleep a 1-year-old needs versus a 101-year-old needs is drastically different. And something to also think about, that the number of REM hours of sleep is difficult to maintain the older we get. And I'm sure anxiety is a component there too, but that's not one that's routinely taught to us. Connie Tai, how do I unclog my nostrils before bed? It always feels like one of them is totally stuffed. If I have a patient whose nose is stuffy quite often, I would try my best to narrow down to the most common diagnosis and try some medications like nasal sprays. I like using nasal saline to clear out the nasal passageways because it's a benign thing to do, doesn't have real big side effects. And then there's other things that we can do like histamine nasal sprays, steroidal nasal sprays. And if those don't work, I really like to get an ear, nose, and throat specialist on board to do a fiber optic exam where they put a little camera in to check the anatomy. There's different parts of the nasal passageways that can be operated on where I've seen patients get good results and then some patients that have overdone it. So make sure that when you do meet with an ENT, you talk about the risks and benefits for your specific condition. Also, another cool tip here is throw a humidifier in your room. Sometimes just moistening the mucous membranes helps a lot. And also staying well hydrated thins out mucus, makes it easier to breathe as well. They say humans use only 10% of their brains. The smarter people use more of their brains. I think this is a complete myth. Like, I don't even have evidence to say it, but I think I've looked this up in the past and I think it's a complete myth. Is there a health benefit to wearing those barefoot shoes with the toes? In some instances there might be, but there are also significant risks. We've seen people develop stress fractures because they have very thin padding, but then some people develop stronger shins. They have pros and cons. Weigh them for your own individual decision. I've never really seen an instance where I'm like, yeah, that was the way to go. I think if you're interested in barefoot training, doing it on sand is probably the way to go. But doing it on hard concrete is just gonna create so much shock that will go into your knees and hips that long term, I don't find it really beneficial. Is marching band a sport? Does it raise your blood pressure, your pulse? Does it make you sweat? Is it competitive? If you answered yes to those questions, definitely a sport. Why can't you swallow while your mouth is open? Probably has something to do with your soft palate or your tongue or a negative pressure that needs to be created. I don't know. I'm gonna guess it's something with a muscle or epiglottis being closed. I don't know. The answer is I don't know. Don't be afraid to say I don't know. Is there a specific rule preventing a doctor from donating their own organs or bone marrow to a patient? I don't think that there's any rule in place for that. I wouldn't even see what would be wrong with that. Why do I sneeze more when I have a cold? Well, that has something to do with the irritation of the airways. Remember, you have little hair follicles that actually try and prevent and catch certain allergens, viral particles, mucus. And when they get irritated, it triggers the sneeze reflex and encourages you to projectile sneeze all those things out. It's actually a protective mechanism. Max from YouTube, is there a health benefit to eating a piece of meat that's cooked rare versus well done? In healthcare, everything has risk versus reward. When you're cooking something rare, you're getting less harmful compounds created by the flame interacting with the food. So you're getting less PAHs, less HCAs. But then when it's rare, you're also potentially exposing yourself to some extra bacterias. Ideally, it's better to find a middle ground where you're cooking the meat to the recommended temperature to kill the possible bacteria that's there, but not overcook it to the point where you're creating harmful compounds. If you get a testicle transplant, I think it's testicular transplant, and got someone pregnant, who would be the biological father? Wait, do they do Testicular see, you learn something new every day. Let's see, testicular transplant. Oh my God, look at this, New York Times. Surgeons transplant a testicle from one brother to his twin. Oh my God, I don't know. If your only testicles are ones that have been donated to you, they're probably genetically the other person's. I don't know. At the drugstore, they offer Advil and then Advil Extra Strength. Why would I not want to use a stronger option? Well, extra strength usually just means that the dosage per pill is higher. You could technically just take more pills of the regular strength one and it'll be the same as extra strength. When you take more of a dose of a medicine, you actually increase the rate of side effects. And there's a tapering off effect where you're not gonna get more benefit when you take more dose, but you will have more rates of side effects. So you kind of have to balance that. Bro, WTF is raw milk. Isn't all milk raw? It starts off as raw, but the milk you get at like the supermarket is usually pasteurized milk. So it's like heat treated and the bacteria is killed. That's why in most cases when yogurt is pasteurized, a lot of the bacteria gets killed. They add probiotics to the yogurt. Can STIs survive in toilet water? Would toilet water splashing up into my genitals infect me? You know what's interesting? I just had a patient that brought this up to me this past week. For some reason, young folks, when they feel embarrassed coming to see a doctor and talk about their sexual experiences, they say that they believe this happened as a result of toilet water splashing up into their genitals. Look, technically, you could probably make an argument that this could happen. The chance of this happening versus it being from an STI, like transmitted through sex, is almost nil. So I would say it's probably sexually transmitted. And at the same time, you shouldn't be embarrassed the fact that you are sexually active, and you shouldn't be embarrassed to speak to your doctor about it because we're not there to judge you, we're there to help you. And we can only help you to the best of our abilities when you're being honest and truthful. What are your thoughts about nasal irrigation when you have a cold? Does it help? I love nasal irrigation with saline sprays. That's like my go-to recommendation for my patients. The nasal saline will clean out mucus, will get rid of allergens, clear out viral particles. All in all, a positive thing when you have a cold. It's the same way that we recommend saltwater gargles, but this is even better because it's going directly into your nasal passageways. So I'm a fan. I saw a video of a doctor on TikTok saying that people who have a dark line in their nail may have cancer. Is it true? This is true. You could have cancer if you have a dark line going through your nail. It's called a subungual melanoma. But what I will say is there are other causes of dark lines in your nails that are not cancer. So don't assume when you have a dark line in your nails that it is cancer. Instead, use it as a reason to go seek out medical advice and check with your doctor if this is something to be concerned with. Should I eat protein before or after my workout? I think the general consensus is to eat after your workout. And I know we talk about that protein window quite often. And when I say protein window, it's like eating and getting protein, maybe even some sugar immediately past a workout in order to get maximal benefit from like insulin release and getting the nutrients into cells. There's some truth to that, but there's also some non-truth to that. And the non-truth is that while it is ideal to eat after your workout within that window, that impact of eating in the window, that benefit, usually goes away after you've been training for a long period of time. What happens if you resuscitate someone who has a DNR? Will you get fired? I mean, if this is a genuine accident, maybe not. I mean, it'll be situationally dependent. There is a world where a family member could sue you, or even the patient could sue you. Are there different kinds of Heimlich maneuvers you're supposed to do depending on the person? Like for a baby versus average adult versus heavy person? Yeah, absolutely. Especially for babies versus adults. You got to think about a baby's ability to regurgitate an object, and the way that you're gonna position them is gonna be much different than an adult. And with a baby, you wanna start with back taps before you start doing a proper Heimlich maneuver. And if you full on press on a baby like this, you could really hurt the baby. So it's a different mechanism, but here are the ones demonstrated for babies versus adults. Why do they call that part of your arm the funny bone? And why does it hurt in the weird way when it gets hit? The rest of my arm doesn't feel that way when I bang it on something, so why that spot? Okay, the funny bone is not a bone. There's a nerve that runs all the way from your neck all the way to your pinky called the ulnar nerve, and it runs inside this groove here called the ulnar groove. Now this nerve is really protected. It's protected well by muscle, by other tissue, by fat, all the way, except in this little canal. I think this is like one of the longest portions of nerve that is unprotected in your body. When you hit that area, you can actually feel the sensation, the tingles, the weirdness. That's nerve pain. Nerve pain is very unique from other types of aches, so that's why it feels funny. But also it's near the humerus, so I guess you could say it's also funny. Is it bad to sleep with a fan blowing directly on you? I actually think that it's not ideal. Think about it this way. If you're blowing a fan, that means it's probably hot in the room. When you're hot, you start to sweat. And when you sweat, the purpose of that is so that the sweat evaporates and cools the surface of the skin. But now the fan speeds that whole process up, and as a result, that area gets extra cool. And when it gets extra cool, your body redirects blood away from that area. Therefore, that area gets less circulation. So it's not unusual if you have a fan or air conditioner blowing on one side of your neck to wake up with a stiff neck. In fact, one of the first questions I ask when a patient comes in with an acute stiff neck is, were you driving with the window open on a cold day, or did you sleep near an air conditioner or an open window? The red heavy YouTube. This is silly, but does sex count as exercise? It does count as exercise. Anything that gets your heart rate up is technically going to be exercise. And research points to most people burning only about 100 calories during like an average 20-minute session. Those numbers are roundabout. So you're not burning a ton of calories. Think about it, like a Snickers bar has like 350 calories or something. So you're not even burning a third of a Snickers bar when you have sex. What about taking a hot bath when running a fever? I don't understand the whole bath thing when having a fever. Some people think getting into a cold bath will help cool you down. Don't do that. If you get into a really cold tub in the midst of a fever, your body can go into shock. That could be problematic. Going into a hot bath doesn't necessarily make it better. Just allow your body to thermoregulate as it needs to. Remember, when you get into a hot tub and you have a fever, okay, maybe it helps your body get warmer without needing to develop chills. When you come out of the tub, you're gonna get really cold because that's the natural state of things. You're not gonna right away get into like an uber warm environment, and therefore you're gonna confuse your body and make it difficult. So just stay out of water as much as you can, unless you're really dirty and you need to clean yourself. Then you could do a quick shower, normal temperature. Sarah Gloria, why is it that when someone has poor vision, takes off their glasses, it becomes a little easier to see if they squint? You're actually creating a focus and you're able to see easier when you're focused. You're concentrating that light on the back of your retina. Why does one of my ankles crack more than the other? I mean, this happens quite often. Patients come in and they have no symptoms other than sometimes their knees or joints make some noise. And in most instances, it's fine. There's nothing scary going on. And yeah, joints make noise and this is okay. Sometimes it can be problematic because it's telling me that there's damage going on. But that is such a rare exception that for most of my patients, I just say, oh yeah, my knees crack too. And I bend down and they can hear my knees crack as well. And why does one crack more than the other? Maybe you have a little excess scar tissue. Maybe one side is slightly longer. Maybe anatomically your bones are slightly different. So do I have the perfect answer? No. But unless it's coming with symptoms or it's progressively getting worse, I wouldn't necessarily jump with alarm bells. What if someone as big as Andre the Giant needed CPR? Could the average person perform it on him, or would extra measures need to be taken? How big is Andre the Giant?
He's like 7 feet, 500 pounds.
My suspicion is if you're a small person performing CPR on a 7'5", 500-pound person, you would not be able to compress the chest cavity enough to make the heart pump blood to the rest of the body. Therefore, extra measures would need to be taken. Perhaps one of those robots that I've seen that they're testing out in the field that does CPR. Maybe one of those robots could do it. What? No pee whoop at the end of the intro? Yeah, so I don't pee whoop after every intro, and that's because some videos are more serious and it feels weird to say pee whoop when I'm talking about a very serious topic. I'm also curious, what is the current stance of pee whoop? Are you for it? Are you against it? Are you confused by it? Leave me a comment, I'm curious. I want a dog so badly, but I'm allergic. Is there anything I can do to get rid of that? Or any other allergy? There are some treatments that exist where you can actually slowly work your way out of an allergy. And there are shots, there are tablets, sublingual tablets that you can do. I'm not an expert in it, but I know it does exist. It's like a form of immunotherapy. I drew YouTube. Where does a memory go when it's forgotten? Left pinky toe. And if you want to get it back, you have to only think about the left pinky toe. No, I'm not sure. Where does the memory go? It just, the connections aren't there to remember it. But I will say the best way to remember something that you've forgotten is to not think about it. Because forcing yourself to think about it sometimes is the worst thing you can do. That's why taking time off sometimes yields the best boost to productivity and creativity. And by the way, this is the one thing that, in terms of like harmful effects of TikTok that people talk about. Before we used to have a lot of free time. So we're waiting for the bus, we'd sit with our thoughts and we'd be introspective. We'd think about stuff. We'd remember memories. But now we're never alone. We're always looking at something. We're always being controlled by whatever it is we're watching. So we don't have that free time anymore. And I worry about that. If someone has a fever that we're trying to cool down and you only have one ice pack, where's the best place to put it? I probably wouldn't want to cool someone's fever with an ice pack. I can't even imagine. Okay, I'm gonna remove the term fever. If I'm just trying to cool someone down because they're having acute hyperthermia or something, I would put it under the armpit. The most surface area that you're gonna get contact with the skin, and it's the most surface area with an important blood vessel, the brachial artery. It's right there. So you're getting a lot of blood circulation moving past that area. I guess you could also do it in your groin as well, but like, same principle. Why do we have boogers? Boogers are mucus. Mucus traps unwanted substances. It acts as a barrier. It's really good. We like mucus. Unless we have too much and then it becomes a problem. So that's when we try and clean it out by using nasal saline sprays. Why don't little kids get sore from physical activities? Even teenagers get more sore than little kids. The beauty of being young. Everything is so ready to heal, so much circulation. Also, it's smaller, so less distance for nutrients and blood flow to travel. But the regenerative capacity of not just a young child, but like a baby is incredible. When babies are sick, the time for them to recover sometimes is like this. Meaning like on day 4, sometimes they'll look very sick, and then day 5, they'll look like nothing ever happened to them. It's incredible. If a woman gets into an accident or falls really hard, could her eggs break? Like if you dropped a chicken's egg on the floor? No, these are not the same types of eggs. Humans have different eggs. They're called eggs because they're part of the reproduction cycle. Very different eggs, no shell on the human egg. I don't have a 4.0 grade point average. Can I still be a doctor? Yes. In fact, getting perfect grades doesn't correlate with a better physician. I will say, there are doctors who just get by and finish last in their class, and those doctors are also called doctors. I have a sore inside my mouth and it's taking forever to heal. I can't exactly put a Band-Aid on the inside of my cheek, so would you recommend anything to help it heal faster? Look, in general, to help sores heal faster, you want to prevent irritation. And irritation can be both chemical and physical. It could be other things, but those are the two main ones that I see happen in my practice. Physical, meaning, you're chewing on your cheek, or you keep biting the same spot of your cheek, or your braces are rubbing on your cheek. Chemical could be like you ate something very spicy, or you burned your mouth. That's like more of a thermal one than chemical, but let's say it was a burn and then you were eating spicy foods and citrusy foods. That can create longer lasting inflammation, irritation. But then, if you have a wound or sore that's not healing on the face or mouth, it absolutely needs to be examined. Because there are cancers of the mouth, there are cancers of the face that happen when you have a non-healing wound. In fact, on the sun-exposed areas of the face, if you have a non-healing wound, it's almost to the level of skin cancer until proven otherwise. And mucous membranes, by the way, are some of the fastest healing parts of our bodies. There's so much circulation there that it actually heals up quite fast. What's actually happening when your foot falls asleep? Either you have suppressed the nerve's ability to fire, so it feels really numb. You cut off circulation to the limb by putting pressure on a blood vessel. Because remember, if you put enough pressure on a blood vessel, you can choke it so that the part further away from where you're choking stops getting circulation. And if it stops getting circulation for a long period of time, those muscles are like, yeah, we ain't working. Those nerves are like, we ain't working. We're taking a break until you fill us up. And that's when you feel the pins and needles and all that good stuff. That mechanism is actually a good mechanism because it's in place to warn you that, hey, you're choking off your foot. You should change position and get up off the toilet, because not only are you choking off the foot, you're probably raising your risk of getting a hemorrhoid, which is why I tell people not to TikTok on the toilet. Is it a big deal if I pee in the shower? It all goes to the same place down the drain anyway, doesn't it? There are some positives and pros to peeing in the shower. It saves time, it saves water, but health risks, there are some unique situations here. Urine is not fully free of bacteria. A lot of people think it's fully sterile. It's not really sterile. Remember, it also has to travel through your urinary tract, which it could pick up some pathogens across the way. When it exits your body, it could pick up some pathogens. So there are some potential sources of bacteria. That being said, there's bacteria all around us, inside of us. That's not the end of the world. But if you have a urinary tract infection and you pee and you step in it and you have a cut, could you get an infection? Yes, pretty low risk. There are also instances of issues of almost conditioning yourself to pee every time you hear running water, like when you're in the shower. So the next time you hear that, you're gonna wanna pee and it's gonna be uncomfortable. There's also instances of like people saying, oh, I should just pee just in case, especially in females where they say, I wanna pee just in case before I leave, and maybe we should pee in between classes so that I never have to go to the bathroom. If you do that too often, you can get into the situation where you train your bladder to send signals for you to wanna pee very early. You could also cause some pelvic floor dysfunction. If you're doing it every now and then and you don't make it a routine thing, I think the risk is pretty low. Pee away, I don't know. It's a weird question. Dr. Mike, do you agree with me that your celebrity doppelganger is Zachary Levi? I don't know who that is. Levi, who's that?
It's an actor.
Do you think that is? I always thought it was Keanu Reeves. Matrix? Would it be healthier to go barefoot all the time like cavemen? No. When you go barefoot all the time, you open up yourself to cuts, scrapes, infections, bone bruises, like there's all sorts of issues that happen from that. So no, protect your foots. Do I need to wash my armpits if I always wear deodorant? Absolutely. You want to wash off the deodorant. And deodorant is just scent and a little bit of alcohol to kill some of that bacteria. So it doesn't actually solve the problem, and it could build up in your armpits and then cause blockages and irritations and ingrown hairs and all these problems. So please wash your armpits. In fact, the most important places to wash, groin and armpits, and the genitals. I guess that is involved in the groin. If you feel a cold coming on, is there actually anything you can proactively do to shorten how long you'll be sick? There's so many cold pills and supplements and hacks, and I wonder if anything makes a difference. The hard answer on this is outside of the basics. I'm talking about staying well hydrated, adequate rest, eating your fruits and vegetables and proteins, lean proteins. There is no magic supplement thing in the pharmacy that's gonna do this for you. I say this as someone who lives that by example. When I'm sick, I desperately want to get better, but I don't go to the pharmacy and pick up giant mega doses of vitamin C. I don't go pick up the zinc tablets that promise miracle cures. Like it's not gonna help. If you're not getting adequate rest, maybe you want to take an over-the-counter medication to lower your fever or your aches and pains, because that will allow you to rest. Maybe you want to take a medication over the counter that can make you sleepy so that you get adequate rest. Maybe in some cases that works. But in general, I try to follow the mantra of less intervention unless it's absolutely proven to help, or I'm willing to trade off the negatives. Or if I'm just giving myself something to ease my physical discomfort, there, I kind of open it up to grandma's cures. Chicken noodle soup, a little cloth pad on the scalp, a little back rub, whatever you want to do. You want to drink ginger tea. If it's not causing you harm and the risk of it not working is still zero, by all means, go. Why is my girlfriend always cold? It seems like girls are always colder than boys. Hard to make that distinction. Having lower muscle mass, lower body mass in general can make you more cold. Having anemia can predispose you to being cold, thyroid dysfunction. So there are certain things, but hard to make that generalization stick. What would happen if you never got rid of a splinter? Would it live in your body forever? You could become best friends. No, it can, like your body can create a little capsule around it, almost like an abscess, because the body does a good job at walling off from foreign substances. Ideally, you don't want that to happen because that can become problematic. So you want to get rid of them, see a medical professional. I don't advise people doing it themselves unless it's like fully out there and easy to reach. Even then, if it starts getting red and spreading, the redness starts spreading, you could be at risk for cellulitis. Kayla YouTube, have you ever wanted to quit YouTube? There have been times where I came close to quitting YouTube. One of those times happened to be when the company that helped me start my YouTube channel, they kind of gave me my initial funding and some resources to start the channel, actually saw us after 1 year, and I thought we were doing pretty decently. We picked up 300,000 subscribers. They said, no, Dr. Mike, we view you as a failure. You turned down some of the sponsorships that we wanted you to take, some BS vitamin stuff and some clothing brands that I didn't really like. I didn't want to lie to my audience. They were so mad at me that they fired us and they labeled us a failure. And in those moments, you kind of look at it and you say, look, I'm a doctor. I really want to focus on medicine. Is this the right path? And ultimately, I wanted to help as many people as possible using the knowledge that I've picked up over the course of my career. And I thought, If I could do this on a scale such as big as YouTube, I would be a better doctor. I thought I'm a family medicine doctor. When our patients were in emergency rooms, we went there. When our patients were in the offices, we went there. They couldn't leave their homes, we'd do a home visit. Now, my patients, not literally my patients, lawyers don't come after me, are on social media. So it's time that we as family medicine doctors take the call to action. And I came back and we proved them wrong and went viral time and time again, and now have almost 12 million subscribers thanks to you. What is with the lackluster P-whoops lately? Are you okay? Lackluster P-whoops. Is there anything I can do to stop drooling while I sleep? Stop thinking about bear. That, in my medical world, I've seen that the most people drool because they think about bear. No, I would want to know why you're drooling. A lot of times people drool because they're mouth breathing, and it has something to do with a blockage in the nose. And that could be something that's treatable with medications due to an allergy or something like that. Or it could be anatomical. There's polyps that can develop in the area. You can have a deviated septum. And as a result, you're constantly mouth breathing, which causes you to drool and wake up dry mouth, dry mucous membranes, discomfort. Your throat feels like sandpaper. You get sick more often. You don't get good quality sleep. You could have sleep apnea, you could snore. So breathing through your nose while you're sleeping is actually optimal. How can I make a scar disappear? There's different levels to this depending on how aggressive you want to be. The earlier you start intervening in the healing process, the better outcomes you're gonna get. And this starts with just keeping wounds covered as a start. That's a very important part of it. Also, depending on how open the wound is, will decide how bad the scar is. In some instances, it might be better to get your wound sutured, especially by someone who's like a plastic surgeon, if it's in a visible area. Next, you have some topical options. There are all sorts of different creams out there that can help with scars. The next level of it can be actually cosmetic procedures where you go in to see a dermatologist to get some laser treatments. And these laser treatments can actually resurface the skin, allowing the scar to look less visible. And then the final level is actually there's scar revision surgery, where uniquely, because of our vision, you could actually do a unique type of scar called a Z scar, where it tricks your eye into not seeing the scar. It's called a Z suture or a Z scar. Really cool stuff. In fact, Dr. Bonasali, who you've seen on this channel, has actually done a good amount of pro bono scar work, including one young boy who was attacked by a dog in protecting his little sister. And Dr. Bonasali had his scars go from this to this. Truly amazing work. Roy Henson, I've heard that if you have toenail fungus, peeing on your toes in the shower will kill the fungus. Is this true? No, it's not true. And actually, toenail fungus is notoriously hard to get rid of. In fact, there are some topical antifungal medications that you could use. You have to use them for like a really long time. I'm talking basically a year. And even then, if you use it perfectly, it still may not work. But then if you go the oral route and you take oral antifungal medication, it is more likely to work, but then there are more likely chance of you having a side effect. How do I ensure healthy beard growth? I think it's about keeping the area well moisturized, clean. You really want to avoid folliculitis because that can damage a beard. But in reality, a lot of the supplements and miracle promises that exist for beard stuff literally just condition the actual hair. They don't actually facilitate healthier growth. I've actually struggled with my beard in the past because I've had kind of some patchy areas. And if you want me to, I have considered doing a hair transplant on my beard. I forgot where I have the little spot here. I was thinking about taking some facial hair from here and putting it here to complete my beard, not because I care at all what my beard really looks like at this point in my life, but I think it would be a cool experiment for you to see how we could actually transplant actual hair follicles from here to here. I was gonna do that a couple of years ago, but because I was boxing, I couldn't sweat for multiple weeks on end while this procedure was ongoing, so I couldn't do it. But if you want me to do it, let me know in the comments. Who would survive longer in the wild, you or bear? Me, easily. Even though I'm scared of insects and bugs and all that. No, don't do it, no! Bear's a chicken. I would know how to like run and hide and be a proper prey. I'm a good prey. He's bad prey. He'll like say what's up to the predators. Although he might be like one of those deer that become friends with the cheetah. I just got a new cat. She's really playful, but I'm afraid of getting hurt if she bites or scratches my hand really badly. Is there a real risk of that, or am I overreacting? Okay, you're actually not overreacting. Cat bites can be really problematic. There was a Mayo Clinic study that showed 1 in 3 people that got bitten by a cat ended up getting hospitalized for it. 2/3 of the people that were hospitalized ended up needing surgery. The reason why I think cat bites are more problematic, unlike dogs who have these blunted teeth and larger teeth that cause a lot of bleeding, cat teeth are more pinpoint and sharp and go deeper. So they actually seed the bacteria deep inside the body, sometimes into the joint or into the tendon sheath. And as a result, that bacteria gets trapped in there and spreads, causing a potential skin infection, cellulitis into the joint, a septic arthritis, or worse off, spreading and seeding throughout the blood, causing a septicemia or sepsis. So the reason for that, and it's kind of similar to dog bites, is there's a bacteria in cats' mouths called Pasteurella. It's a serious bacteria that requires antibiotics. Don't sleep on cat bites. Also, there's cat scratch fever. There's even things from kitty litter and why we talk about pregnant women not changing kitty litter because of how problematic that could be. There's all sorts of cat-related illnesses. In fact, maybe I should do a whole video on that, but then the cat people will come for me. I drink 2 to 3 cups of coffee a day. If I stop drinking for a day, get a headache, what can I do to stop the headaches? There is a condition called caffeine withdrawal headache, and it usually comes on pretty quickly when your body gets used to essentially developing a tolerance or a dependence on caffeine, where if you don't have caffeine over a period of 48 hours, the blood vessels in your brain are thought to swell a little bit because of the lack of caffeine. And when they swell, that pressure increases and you start getting one of these withdrawal headaches. That's the proposed mechanism. It's not 100% proven, but usually just having 1 cup of coffee on your off day will decrease the sensation of that headache if it is caused by a caffeine withdrawal. What's cool about caffeine is that while your body does build up a tolerance, getting your body to get rid of that tolerance is a fairly quick process, meaning just doing a few days without coffee will allow your body to get a really strong kick of caffeine on the 4th or 5th day when you actually reintroduce it. Pretty cool stuff. We've learned that through athletic trials. Emma, is it possible to cure vertigo? It can be treated. It really depends on what the cause of vertigo is. Because while vertigo is labeled as a condition, there's a lot of conditions that cause vertigo, and I like to consider vertigo more of a symptom. Very commonly, I have patients come in with a condition called BPPV, benign positional paroxysmal vertigo. And this happens quite frequently when someone changes head positions really quickly, where the little crystals inside their semicircular canals are kind of stuck or misplaced, and as a result, they experience this really severe sensation of vertigo that is short lasting, but is triggered by some unique head movements. It's benign, meaning it's not bad. It's positional based on the position. And paroxysmal means it doesn't happen all the time. And for that, we actually do a maneuver called an Epley maneuver, where we can teach you to do it in the office, or you could do it yourself at home, where you aim to reposition those crystals in your ear and can actually help battle some of those symptoms of vertigo. But that's not the only form of vertigo. There's a lot. Is there health risk to riding roller coasters or going to haunted houses where your heart rate spikes to super high levels? I would say there are probably health risks, more musculoskeletal than anything, being on a roller coaster, like jamming your neck around, unless you have a pre-existing heart condition or something. But if you're an average healthy person, having your heart rate go up is kind of physiologic. When I say physiologic, that means it's normal. It's not normal to have your heart rate go up to 150, 160 as an adult if you're at rest. But if you're in the process of being scared or you're running, it is normal for it to go up there. That's called physiologic heart rate range. That's why when someone measures their blood pressure, like standing and talking to somebody, I say that's not a resting blood pressure measurement, so I can't diagnose you with hypertension off of that. I need you to sit still, relax for 5 minutes, and do it properly as the CDC does it. Only then can you get a proper resting blood pressure, because that's what I'm interested in. Not the fact that your blood pressure adjusts to whatever exercise or physiologic condition that your body's experiencing. Is it theoretically popular to exercise so much and burn so many calories that you stop pooping? No, because there's components that you have to excrete. That's why it's called excretion. The more fibrous foods you contain, the more stool bulking supplements you take, the bigger your stools can be. And sometimes that's beneficial, sometimes it's problematic. It really depends person to person. This is why fiber supplements, for some people, can help get rid of constipation, and others it can cause constipation. So you gotta be really careful and toe that line very gently. Can stress cause acne? Stress can put you into a pro-inflammatory state. So to some degree can cause acne. Even if you just look at stress creating higher blood sugars, that absolutely can happen from a hormonal standpoint. And when you have higher blood sugars, you tend to have more inflammation in certain areas that can cause some acne. But is it like the #1 cause of acne? I would probably venture and say no. Anna, did you ever wind up getting Botox in your armpits to reduce sweating? No, I just made peace with the fact that I'm a sweaty boy. Bear's a drooly boy and I'm a sweaty boy. Kelly, Discord is, oh, thank you for being a Discord member. By the way, join our Patreon link down below. It's $9.99, but I don't keep any of that money. All the money gets donated at the end of the month and it goes to a charity of your choice where we have a monthly live stream and we chat privately. No one can access it except Patreon members and you get to chat in our Discord, all that good stuff. Okay, sorry. Is there any benefit to breathing in a paper bag when you're hyperventilating? Yes. When you hyperventilate, you can blow off too much CO2. And when you blow off too much CO2, that can create an acid-base problem in your blood and it could cause you to pass out. But when you breathe into a paper bag, you're actually breathing in the CO2 back that you exhaled, so you don't lose as much of it. And as a result, you don't pass out as likely. You're not as likely to pass out. Sam Desoglas, who is your favorite superhero? You know, I never thought about that. Actually, I did. It's my dad. Aww. User VG, my wife got me an ear cleaning kit from TikTok that has a camera, a light, a rubber tool at the end. Is it safe to use? No! Please don't use ear cleaning kits. The only thing that may be safe to use at home that I would recommend to some patients are those like earwax dissolving drops, and then maybe the bulb to like flush things out. But even then, I would still recommend coming in to see your primary. Chimone T1 from Discord, what are your feelings on the TikTok ban? Okay, first of all, we need to set the record straight. No one is really gonna ban TikTok. Even the thing that's the bill that's being passed is not a ban. China owns TikTok. And what the bill that's being proposed is trying to do is to say that there should be a forced sale of the company to another organization, institution that is American owned. And there are legitimate reasons why we would want that sale to happen. First of all, I've been pretty vocal on TikTok being not great for humanity from like the short form content. I feel that they are less stringent with the algorithm and allow unsavory content that is damaging not just the youth, but all of us as individuals. When I see someone I have a crush on, does my heart literally skip a beat? No, but it can speed up. And you could even have something known as a PVC. Like a PVC is a premature ventricular contraction where your heart like beats, but nothing really happens. So it's like an incomplete beat, if you will. But they happen rarely and without symptoms, usually pretty benign. So the answer is maybe. Help, I fart really hard and it hurts. How do I fix this? Is there a name? Fart splints or something? Sam, you know what it is. Painful fart.
Sam, you've got painful farts.
The answer is what's going on. Sometimes there's hemorrhoids, and there's two different types of hemorrhoids, internal and external. External is usually the ones you feel because they're past the pectate line. There's also anal fissures that can bleed quite badly. You can actually end up getting a cream that's called nifedipine. It's compounded with usually some lidocaine or some other numbing agent that allows that sphincter to relax a bit and heal better. There are surgeries, obviously, but those are for more advanced cases. Someone please tell me, if you had no bones, could you still move? No. No. Well, no.
No. Well.
Because your muscles are attached to bones. And if you have no bones, the muscles weren't attached to anything, so you couldn't move. Why do vegetables taste bad? Why can't they just taste good? I disagree. I think an asparagus in my mouth after a steak is wonderful. Asparagus, right? When there's multiple? I'm Googling it. It's either asparagus or asparaguses. I take back my asparagus. Okay, there are no asparagus in my mouth. Only asparaguses. That sounds weird. I'm 25 years old. I've never had a nosebleed. I would very much like to experience one. How would you, no. What am I reading? How do I know if I have a slow metabolism and whether I need to speed it up? Unless there's an issue, meaning you're struggling to lose weight and you've been documented to be overweight and there's a health condition that's being impacted by the fact that you're overweight, I wouldn't worry about your metabolism per se. And in general, the things that you would do to live a healthy lifestyle will help you maintain a healthy metabolism. I wouldn't think about it as slower or faster, because a too fast of a metabolism is also problematic and too slow is problematic. So ideally you want a balanced metabolism, and a balanced metabolism is one that comes with a healthy lifestyle. Obviously there are some factors outside of your control, but that's when diseases happen and that's when a doctor should intervene. All of your hiccup cures are just the top results on Google. What makes you any better than just Googling what's wrong with me? I guess you can. It's just Google's gonna give you a lot of info and it's gonna be in text and boring, versus here we're having fun and enjoying the time together. Hey, how are you doing?
How you doing?
I've been having a lot of problems with excessive sweating. I know you've dealt with this a lot, so do you have any advice? Become okay with sweating is a good piece of advice, and I've become better with it, understanding that it's kind of part of life. There are prescription strength deodorants that you could use. You could even use them on your palms if that happens there. There are injections like Botox that you could inject directly into sweat glands. I've never went down this route, but I've heard people do it, and I've met doctors that do it with good results. You just have to do it maybe a couple times in order to get longer lasting results. I don't know. I kind of just sweat and live. You got so triggered in your last meme review by people saying they shower at night. I shower at night because it keeps my bed cleaner when I go to sleep. Do you really think showering in the morning is better? Yes! And I take a passionate stance on this, and I want to argue with everybody in the comment section that I prefer to shower in the morning, and that's the logical way to go. Let's lay out a list of pros and cons of showering in the morning versus at night. Let's say you shave very frequently and you get some nicks sometimes. Maybe it's better to shower in the morning. Why? Because you have more platelets in the morning. Interesting, fun medical fact. Let's say you're stressed out when you wake up in the morning, or you need a little creativity bump. It's a good time to do it right there in the morning. And you know what you do at night? You sweat. Usually more than you sweat during the day, with the exception of exercise, obviously. You're gonna have oil in the night, you're gonna have sweat in the night, clogged pores in the night, so waking up in the morning and showering gets you ready for the day, cleans off your body, and makes you ready to go on. The only thing I would say is if you're gonna shower in the morning, shower a little bit cooler, because warmer might make you sleepy and wanna go back to bed. But now, for the people who like to shower at night, ideally, if you are doing this, it can help you fall asleep, especially if you do it like 90 minutes before. You keep it short, like 5 to 15 minutes, because if you're exposed to a lot of heat for longer than that, it can actually be activating instead of sedating. Benefits, obviously, throughout the day, you get dirty, oil, all that stuff, and therefore you might not want to bring that into bed, which can be acnegenic, causing some clogged pores and stuff. Also, it might be better to shower at night if you're sun sensitive, because if you exfoliate, for example, and then you go out in the sun, that might be a problem because your skin's more sensitive. But if you exfoliate at night, for the morning, you're ready to take on the day. And probably the best reason for most people that have allergies to shower at night is because you wash off all the pollen that you got on you, and then you don't bring it into bed so you sneeze less. Do with that what you will. But for me, morning shower, and like post-exercise, obviously, because you don't want yeast and all that stuff developing. Did you become a doctor because your father forced you? Because I think you'd be a better stand-up comedian. Okay, you're probably being sarcastic. No, my father didn't force me, and I would not be a better stand-up comedian. I would like to try my hand at it. I kind of did on the live tour, and I had like 2 good jokes. In order to see them, you have to come to the next edition of the live tour, whenever that's happening. Is Bear in a Jeep Grand Cherokee commercial? There is a Newfoundland dog named Bear in the Jeep Grand Cherokee commercial, and I am kind of upset that they didn't use my bear. Bear, you know you're in a commercial? Come here. Have you been secretly going out and earning in the night Jeep Grand Cherokee ads? I should get at least a little cut. I feed you. Wow. I don't care if you're working without my permission. Come here. But you do need your working papers, all right, son? Just next time if you do a commercial, can you do it for like a Lamborghini so they give us one for free? Do people actually sleepwalk? How can I make sure it never happens to me? You can't make sure, but if you sleep well, you sleep the same number of hours consistently, you don't take any substances that impact your sleep, the risk of you sleepwalking decreases, but you can't be 100% protective of it. Is it normal to have migraines every single day? No, absolutely not. In fact, while we have medications that are abortive in nature that stop migraines, there's also medications that are preventive in nature and that prevent migraines from coming on, and you should discuss those with your doctor. And not all of them are labeled migraine medications. Some of them are like heart rate medications, that like beta blockers that actually help with migraines, or antidepressants that can be used off-label for migraines. So worth a discussion. When the doctor asks if I'm on any prescription drug, should I tell him I'm using prescription toothpaste, or does that not count? I've yet to hear about prescription toothpaste, but absolutely it counts. It should be, are you taking anything, period? Like prescription or non-prescription, those things still have side effects. So I don't even understand the distinction between the two unless you're asking to refill a prescription and send something to the pharmacy. I never just ask my patients, are you taking any medications? Are you taking any medications? Are you taking any supplements, any creams, etc.? So toothpaste absolutely falls into that category, prescription toothpaste, because that's not just like a regular over-the-counter product. Are breads that have a bunch of visible seeds in them actually healthier than bread that doesn't? Or is that just a marketing trick to seem healthier? Well, first of all, Lizzie, some people enjoy those seeds. Like for example, I like bread with pumpkin seeds or sunflower seeds on it. I think there's a big factor to be had with flavor. There's also different macros that come with those breads because depending on the type of seed, you may increase the protein concentration. Also, the big hack that comes from having seeds is fiber. If you don't mind the seeds, I add them on. Can I become more tolerant of mental health medication? 30 milligrams used to do the trick, but it doesn't feel like it has the same effect anymore. Have I gotten used to it? It really depends which medication you're talking about, because some medications absolutely do have a tolerance building effect. Xanax, as an example, like those are benzodiazepines. The answer is it depends. Do you have a workout playlist you can share? I don't. I just like use dance workout playlist. Actually, I could show you a picture of it. Workout music hits 2023. It's a really random playlist, but I like it. Is it better to hydrate myself with warm or cold water? There's probably no perfect answer to that. Really cold, not ideal. Really hot, above 140, we've seen rates of esophageal cancer going up. So again, stay away from the extremes. What is the actual risk of drinking alcohol if you're on painkillers? What could actually happen? Well, it depends which painkillers you're talking about. If you're talking about opioids, obviously there's the risk of respiratory depression. And then if you pass out, you can aspirate your own vomit and die. When you're drinking alcohol, you're less likely to make good decisions. So you could take too much of the painkiller and OD. When it comes to like stuff like Tylenol, it takes a load onto your liver because your liver actively needs to filtrate it. And in fact, some of the biggest hospitalizations for liver failure come from an overuse of acetaminophen, which is the active ingredient in Tylenol. And then when it comes to like the Advils and Motrins of the world, these are NSAIDs, non-steroidal anti-inflammatory drugs. And those can actually have an impact on your stomach lining, which then by drinking alcohol, which irritates the stomach lining, kind of has a doubling effect of irritation, causing worsening gastritis, especially if you have an ulcer. Is it true that eating poppy seeds on a bagel can cause you to fail a drug test? How long does it take for those seeds to clear your system? You know, it's a good question, I don't know, but anecdotally, I have heard this to be true. Specifically in like armed forces and police officer exams, they tell you not to use those products. Is it healthy and safe to eat insects like crickets? I'm seeing them become more popular here in Europe and I'm skeptical. If they've been prepared by an adequate food agency, I don't know what the equivalent of FDA is in Europe, then I don't see why that would be a problem. Eating them fresh off the ground, I can imagine that some things could go wrong. I don't know, not really a wildlife expert. So is playing chess an exercise? Because when I play, my heart rate goes way up. You know, I used to think no, but there's been articles coming out of individuals losing a significant number of pounds while playing chess in tournaments. You know, glucose feeds the brain, so it obviously burns some calories, your heart rate goes up. I would say that it's an imperfect exercise because it doesn't make use of your muscles, your musculoskeletal system, and as a result, you can develop aches, pains by being in the same locked-in position. I would say incomplete exercise, but a good exercise nonetheless. Val, what time of day is best for working out? Can I make more progress going in the morning, for example? Is there a time of day the body's more primed for exercise? I've seen this go both ways within my patient population, even for myself. For example, if I'm gonna do a low intensity, long exercise session, doing it at night doesn't bother me. It actually helps me fall asleep real well. But if I was to do sprints and doing them close to bedtime at night when I dump all of that adrenaline, it's actually hard to fall asleep and I need some time to wind down. Also, some people are not early morning risers, so when they wake up, they don't feel great. That works also even more both ways, that some people will start exercising and feel better, therefore that's kind of their hack to getting started. And other people just don't get good adequate performance and they would prefer to work out later in the day. But medically speaking, we don't have a thorough answer for that. You said sweating more means you pee less. Does the same apply to crying? Can I cry so much I never pee? Never pee, no, because you're still gonna be using liquids unless you stop drinking and then you keep crying. Ultimately, your tears will dry up probably before your pee. In fact, if I see a child in the emergency room and their lips are dry and they're crying and I don't see tears, I'm really worried about dehydration. Why do I get hiccups anytime I eat any really spicy foods? Oh, that's probably because you're irritating your diaphragm and your diaphragm starts to have like a spasm in it. If you take like an inhale then a little bit more inhale without exhaling, and then another one real quick, really fast, and really hard. It actually stops the hiccup. I don't know how, like, it like paralyzes your diaphragm or something. What advice do you have about whether a patient should go see a doctor that works in a giant hospital and a healthcare system versus seeing a doctor with a small local private practice? I think most days, doctors that are even local private practice are affiliated with bigger institutions. I'm a fan of having a small local physician that you have a good rapport with and a long-standing relationship with. And then if something is outside of their practice or their abilities to help you, they have a healthcare system behind them that they can refer you to. But a giant hospital could be really good if you have a rare condition, or obviously like a level 1 trauma or something like that. Why do I keep getting Charlie horses in my legs when I'm trying to sleep at night? Most commonly for young, healthy, athletic people, this happens as a result of fatigue. If you over-fatigue a muscle, especially if you start a new exercise regimen, you go a little too hard, you could start developing those types of cramps. Also, there's obviously issues with electrolytes in some people that are maybe dehydrated or they're not just taking in enough electrolytes. How can I learn to swallow a pill? Oh, there's actually really useful diagrams on Harvard that they show. I'm showing them here about using a water bottle where you actually like suck the water bottle and allows you to swallow the pill better. Obviously, there's certain pills that you can crush and like sprinkle into yogurt or applesauce or something. Just be careful, not all pills are able to do that. Make sure you read the instructions really carefully. Why does a baby become comforted by a pacifier? It tricks the baby into thinking they're being fed, I presume. It's the suck reflex, so makes sense. I'm not a huge fan because it changes the development of the baby's mouth. I try to minimize pacifier use, or at least encourage my patients to minimize pacifier use. But that being said, I understand a crying baby is very difficult, so I understand the need for a pacifier. Is rosacea a bad thing? I've always had it, but always thought it was just one of my beauty traits. Well, it really depends what's causing your red cheeks. A lot of times doctors will say it's rosacea, but it could be rosacea plus something else. I would more so look at the symptoms, how much they're bothering you, what else is going on in your body. Generally speaking, rosacea is just kind of a blood vessel issue that causes some discoloration on your skin that usually is localized to the area, but not in every case. Sometimes rosacea can be paired with autoimmune conditions, for example, or rosacea can be diagnosed when there's really a more correct diagnosis like lupus and you get the butterfly rash. So you gotta be really careful when it comes to rashes. Why do left-handed people die sooner? Good question. The theory is that most tools, especially heavy machinery tools, dangerous tools, are not made with left-handed people in mind. As a result, higher rates of accidents. Interesting, right? Scary too. Where does air from a burp come from? Am I burping out air from my lungs, or is there air in my stomach? It comes from your stomach. There's normally air in the stomach. When you eat food and you swallow, some air gets swallowed into your stomach. In fact, when we do x-rays, we sometimes use the black portion within the stomach, which is the representative area for air, as knowing that's the stomach. And if we see air outside of the GI system, like randomly in the abdominal cavity, then we know that there is an injury to the GI system, whether it's the stomach, the intestines, etc., because there's not supposed to be air in our actual abdominal cavity, like outside of the intestines and stomach, and esophagus, of course. How can I prevent razor bumps when shaving? Proper use and hygiene within the shaving realm. So you want to make sure that the blade you're using is extra sharp, meaning that it's not dull and old. You want to make sure it's not dirty, susceptible to infecting hair follicles. You also want to make sure that the pressure you use is gentle and not having it press really hard against your face, because what can happen is you could actually dimple the skin so that parts of the skin actually get caught within the razor blades, therefore creating little micro traumas leading to that bacterial infection. And obviously using good quality products that match your skin type. So you want to think about shaving cream, cleansers, moisturizers. This will go a long way to making sure you have healthy skin. What's the best method for thawing frozen meat? I usually put it in a bowl of warm water in the sink to thaw it quickly. Okay, this is so important. So many people chuck meat on their counter and they're like, oh, it's gonna thaw, it'll be fine. No, you're allowing certain parts of the meat to enter what they call the bacterial danger zone, where it actually grows very quickly above a certain temperature. And remember, when you leave something out to thaw, the outside thaws much quicker than the inside. So while the inside is still thawing, the outside is growing massive amounts of bacteria. So what you wanna do is thaw thaw in your refrigerator. And yes, I hear you. You're saying, oh, the refrigerator takes too long. Sometimes can take more than a day. Yes, that's true. There are ways to speed up the thawing process. One of those ways is using cold water. You could also use the microwave to thaw. If you use the microwave, though, immediately after thawing, you need to start cooking that bad boy. Something that's lesser known is that most of the stuff that you're trying to thaw and cook, you can just cook frozen. So be smart. Don't get food poisoning unnecessarily. Do you pee more when you're stressed or nervous? I feel like I do. Sometimes that can happen based on the triggering of your sympathetic nervous system. Also, some people feel like they need to pee when they get cold. Remember, cold things shrink, and if your bladder shrinks, you might feel it more. And sometimes it's just a nervous reaction. Part of what your body does is it wants to get rid of that urine. Hypothetically, would SpongeBob SquarePants bleed out from an injury or just absorb his lost blood because he's a sponge? Minor injuries don't affect SpongeBob because sponges are meant to take abuse, and that's called anti-sponge cut syndrome. If he was to get a significant laceration, he would actually just let that part of him go and no longer be SpongeBob SquarePants, but SpongeBob abnormal shaped SquarePants. Is it true that I should brush my teeth in the morning before drinking water so I don't swallow all the bacteria that grew in my mouth overnight? Yeah, I think it makes sense, but I don't think there's like a hard and fast rule. I think if you're thirsty in the morning and you're really dehydrated, please drink water. And I think brushing your teeth first thing in the morning is not just good for oral health, but great for people that have to smell your breath as well. You know, halitosis. What happens when you get a lymphatic drainage massage? Are the benefits real? To be honest, most massages probably aid in lymphatic drainage because like you're moving circulation, you're creating lymphatic flow. Maybe the lymphatic drainage massage focuses more on the areas where there are lymph nodes. Look, some of the benefits are real in terms of relaxation. It helps you open things up, or you've been standing on your feet all day, you want to raise your legs up and get a massage. Just don't think it's magical. There are some benefits, but don't think it's magic. That's how I would put it. What's your least favorite medical terminology or medical name? Borborygmy. I think it's a rude term. It just feels like I shouldn't be saying it. Like, say it. Didn't that feel wrong? Borborygmy. When you break a bone, where do the little broken bits go? Do they just live in your body forever? Yes, you become one with the broken bone. No, I mean, if you're fracturing a bone and you're losing a piece of the bone, it's a significant piece of the bone, that won't heal well. And you're gonna need surgery, maybe to put pins, rods, etc., to allow the bone to heal properly. Now, the body does have ways to get rid of microscopic small pieces of bone. There are cells known as osteoclasts. These break down bone material. Osteoblasts on the opposite end actually build bone up. So no, people who break bones don't just have little bits of bone floating around in their bodies for long periods of time. What are shoulder blades for? Mostly cutting carrots, celery, you know, healthy meals. Sometimes if you're boxing, shoulder blades are really good for movement. No, it's actually a very unique part of a body that allow really good range of motion for your shoulder. Scapular dysfunction is actually one of the things I check for often. For those who are having shoulder pain, sometimes they will overtrain or undertrain certain parts of their rotator cuff, leading to the scapular dysfunction. There's stabilizer muscles that people forego when they're not training, and as a result, they're more prone to injury. Very, very unique bone and very, very unique attachments to said bone. Is a dentist qualified to help you with a tongue problem, or are they not trained in all areas of the mouth, just the teeth? A dentist should be able to spot areas that are concerning. If they themselves aren't qualified, they should be able to refer you to an oral surgeon, which sometimes can be an ENT, sometimes it could be a facial maxillary surgeon. They definitely could be ones to spot certain lesions. Those who smoke have higher rates of oral cancer. Those who are infected with HPV, human papillomavirus, can have oral cancer. That sometimes is caught first by dentists. And there's all sorts of other, ranging from benign to more malignant conditions of the mouth that dentists should be readily spotting. What would happen if a child needed surgery and only one of the parents consented to it? Say the mom would say yes, but the dad said no. That's a good question for a bioethicist. I think if a child needs surgery, like life or death, it gets done. Because if, like, let's say two parents refuse a surgery that is important for the child to survive, the decision gets made to still perform the surgery. I think it gets more tricky if the child sort of needs the surgery and the one parent says yes, one parent says no. I love swimming in the summer, but I'm always getting swimmer's ear. What can I do to prevent it? Earplugs. Or careful drying after the fact, which could mean jumping on one foot, really good towel drying. Just don't put anything in your ears in terms of Q-tips or stuff like that. Don't do it. Don't do it. And by the way, swimmer's ear is otitis externa. What would happen if you administered an EpiPen for someone who was in anaphylactic shock? Would it juice them up with superpowers? No, it would make them tachycardic, hypertensive, uncomfortable, sweating, nauseous, all the things that happen as a result of getting an EpiPen without any of the benefits. So please don't do that. This isn't Compound V from the boys.